Good morning and welcome to the session on capacity building and digital platforms. My name is Carolyn Perrin from the Geneva Digital Health Hub, and I have the pleasure to co-chair the session together with my colleague Loretta Latunico from the European Space Agency, with facilitation by Sara Aparicio. This part of the forum is dedicated to a very important question. How do we ensure that Earth observation tools that are being developed don't remain in labs or agencies, but are taken up by users and stakeholders in health systems, NGOs, and communities? Today's session will highlight different perspectives from international organizations to innovators and set the stage for practical next steps. We will begin with a keynote by Roya Ayazi. She's Secretary General of NEREOS, leading European regional cooperation on space technologies and their impact on society. Thank you very much, and the floor is yours.
Good morning, everyone. Warm welcome. First, I'd like to thank Stefano Ferretti and his colleagues for the kind invite. I'm very pleased to be here the second time and to share our perspectives. I prepared for you some points of reflections. What can we do to really bring these space solutions that ESA and so many people in Europe develop really to the end user? Before I go in depth, I made some slides because I saw also there are people from outside Europe to explain what's our vision, where do we start from. And I had also a discussion with Loretta before the session started, and actually, we all have the same challenges to say we have a lot of solutions, but how can we bring them more systematically to the people? And I think one answer is Europe. I think we have to look at what's happening here and to see it with a European dimension. As single nations, I think with the huge challenges we are facing, we are too small, because that's what I want to start my discourse. Really look at Europe, and as an organization, we are a European network and understand ourselves also as this really looking at the continent, looking at the diversity of people, looking at the diversity of challenges we have in this continent. When I speak of regions, people outside Europe sometimes they think of regions in global terms. That's why I need to explain how do I refer to regions. And we are a European regional network of European regions, and our standing is that's the level next to the national, the federal state. And that's in Europe quite important, because a lot of programs at the national and at the European level are implemented at regional level, at local and regional level. Like the agriculture program, for instance, is one of the biggest EU programs, and a part of its pillar is implemented at the local and regional level. In many countries like Germany, regions have a very strong position by the constitution. They have, by the constitution, certain competences. They are in charge of certain policies. I think when we want to ask this question, how do we bring space solutions more to the people? How do we extract from the solutions we develop the benefits and bring them to health systems, to really concrete implementation actions? We have to think of policies, and we have to think of laws. And the first question we have to ask: who is actually responsible? Who has the mandate for health policy? Because this is the people you need to talk to. And primarily, it's the national level. However, and I think this is the most relevant for Earth observation and what you were discussing, if we look at the environmental risks, at the risks that come from environmental developments on our health, we are in a different setting. In that case, usually the European Commission has a shared competence with the national state. So the national states are in the first place responsible. Hospitals, health strategies, for all this, the Commission can give recommendations, can see what are best practices, and can say, look, dear member states, this works very well in Europe, but they are not really in charge. When we talk about environmental risks, the picture is completely different, because environmental risks, if we talk about air quality, if we talk about water quality, they don't stop at borders. They go across, and there the Commission has legislative powers and can propose legislation. And I think this is an important aspect I would pass, or message I would like to pass on to this group, that to have a concerted dialogue with the European Commission, to get them to propose legislation, to propose activities that show more what are the benefits of Earth observation for the health sector. And I think this is quite difficult to do. When we look at the health sector, for heavy diseases, it's not difficult to do lobbying. For heavy diseases, cardio, heart, you have strong stakeholder groups behind, you have strong industry behind that are interested to boost the pharma industry and interested to sell medicine. If we talk about monitoring environmental risks and health risks, the situation is difficult, because this is before. And actually, it's unpopular, because if you do well, you don't need medicine. So the industries won't help you. And unfortunately, also the public authorities are not too eager to help you, because it's something negative about their territory. Public authorities are careful to release, to discuss bad air quality or bad water quality. You really have to fight for this. But I think if you show and I think there we need to work and get good material to show the benefits of prevention, of monitoring the risks, that in the end, the health systems of all European countries will benefit considerably. Regions are also, in the sense when it comes to the monitoring of the environmental risk, an important partner and interlocutor for you, because they are often responsible for the territorial questions and for this monitoring questions. Since COVID, we see a paradigm shift. We see that COVID in all European countries showed the weaknesses of the health systems, and that public authorities at national and local level, and I think that's also at European level, are under extreme pressure to optimize their health systems, to respond to aging society, and to respond to less money. We have now the European Commission in June presented its budget proposal for the next 7 years. And we see the budget fights, the tension will be more. And I think especially in the health sector, we have to see and find approaches and discuss approaches to use available resources more efficient than in the past. The pressure gets worse. And I think their space solution, and that is what we see also with our regions, that they said, we need, it's a priority in our region. We need now to look into all possibility opportunities, into all tools to shape our health policy and our health strategy more efficient. And we see in Europe, with aging society, with more diseases being at the concern of people, that elections in Europe are won with health. This is what concerns the citizens primarily. It's safety, health, education comes then, but health is among the priorities. This is where the citizen is concretely concerned. We did a webinar with ECMWF, and we think that was also for us an important partner, showing really the different approaches. How can you better use Copernicus data? And we try to do with these kind of online events to make best practices more visible. And we try to bring public authorities from the health sector to the floor, telling us what are your challenges in your daily life. I looked at my regions and I tried to illustrate, you have now 4 days discussions, and I tried to illustrate a little bit what are health challenges in regions, and what is their daily, what do they have to find solutions for. And one of our members are the Azores. It's an outermost regions. It's a group of islands in the Atlantic, south of Portugal. They are halfway to the US. If you are a public authority in the Azores and you want to bring health service to your citizens are spread over 9 islands that you can't easily reach. You have to take an airplane. Of course, the majority is in the capital, and are in that respect reachable. But a lot of your citizens are difficult to reach. And I had a look what do they have for environmental risk, and they face increasingly the risk of earthquake. They have volcanic eruptions, and that has a direct impact on their air quality. So air quality monitoring is really in all our regions a very important topic, and finding their common approaches to better organize this at a European scale is, from our point of view, an important factor. I read an information from the European Environmental Agency that said that 300,000 premature deaths in Europe are due to bad air quality. And I think there we have to look. We have also French Guiana in our territory, in our network. French Guiana is a territory in the Latin American continent, completely different climate, a much stronger water stress, water scarcity. They have also the risk of mercury contamination, and with Earth observation, you can extract information to better manage risks. And also there, I know that the French Space Agency has a lot of health best practices in Guyana. That could be maybe also interesting for your community to look at. That's a territory in Europe where they are very advanced with remote health. I think what we have also, when we discuss it at the European scale, to look at that delivery of health service is very different between urban areas and rural areas. Rural areas still lack that they are difficult to reach, that there are less people. And the national level, there is at the moment a tendency that they bundle, that they concentrate as centers, and that the existing hospital get huge. They can do everything, but they are more difficult to reach. I know from the discussion in Italy that, for instance, for many years they did health policy by building hospitals. So every citizen could easily reach a hospital. They bought in all municipalities. But if you spoke then with medical people, they said, yeah, it's just winning votes, because these hospitals, they are not very well equipped. They cannot do much. And I think there we bring with space a new approach, because you don't need these investments in equipment, in infrastructure. You can also, and I think this is when you discuss with politicians, when you discuss with administrative level, that in an easy way you can argue that with monitoring environmental risk, with monitoring health developments remotely, you can bring more equality. You can reach more people in a larger scale. Very important in our network are the congested urban agglomeration and the areas where you have strong industry, like Po Delta, like some areas in Germany, like close to Madrid, where you have a very bad air, where you see that concrete impact on health through the strong NO2 contamination and so on. And we can see it also. I looked a little bit, what is the health commission of the European Parliament doing? And that air quality is more and more a topic, and that we should use the tools available from Earth observation to really look at it. I could see that the Commission is doing a lot of work on air pollution. They try to come closer to the WHO standards. It is an important point of discussion, and I think there also your group bring examples to the parliament, bring them to the discussion, develop good material where you can show what are benefits. Climate change has arrived in the also in our discussion, in the mid of Europe. Water scarcity, water stress, heat waves, heat islands is not a topic of South Europe. It has arrived in France, it has arrived in Germany, and even in more northern countries, urban policies are really made. We have to be ready. We have to do our cities to avoid strong heat islands. And I think there also Earth observation data is crucial, should be brought stronger in the discussion, and you can bring concrete examples where the benefit is shown. Water quality, I just talked. I had brought you some examples from our Copernicus for Regions initiative. This is our flagship, where we work with the European Commission and the European Space Agency. We do a little bit what this session is here about: capacity building, community building, outreach awareness. We develop a material to discuss with policymakers, with the administration. And I like to bring you this as an example. I could envision something like this for the health sector, or giving us stories from the health sector that we bring it to the attention of parliamentarians. This is what I would like to invite you. We have there experimented since 2010 that we have developed an approach grasping concrete, tangible user stories from the local and regional level, looking not really what are the fantastic procedures. They are fantastic, but really looking and pinning down what is the benefit for the citizen and what is the benefit, what to get a testimonial from a public user, from a public authority. And we bring that to the parliament and discuss it with parliamentarians in public policy contexts. I think awareness uptake challenges are really this where when you want to reach stakeholders, this is important. Bring it in policy contexts, and everything starts with a vision. This vision should be more systematic, really looking how can we combine, how can we bring together these challenges in the end for strengthening, for showing, and for avoiding that we are too much under health pressure. And a very important creation of political will, the dialogue with politicians, with the European Parliament, and bringing it really. And there you have always a responsible somebody you can hold responsible if you have laws, if you have it in the legislation, you have the connection. In one thing I like also to highlight what we experienced in this initiative. It's quite important to make this connect when talking about community building, outreach, to make this connection between the service provider, the researcher that develops the service, and have a link to the user and the political level, and really showing it to the stakeholders. With this, I like to thank you. So I stayed in 20 minutes.
Thank you, Roya, for this very inspiring keynote. Are there any questions for Roya before we jump to the speakers session? Okay, then I believe we can continue. My name is Loretta Latronico, as mentioned by my co-chair, Caroline. It's an honor for me to be here today and to spend this time with esteemed colleagues, researchers, doctors, professors, and Earth observation specialists. I believe those are very big opportunities for us to create a community feeling. I hold a PhD in managerial engineering at Pisa University, and I am an economist by education. My research is centered on AI for well-being and for sustainability and gender equality. I also bring into this forum my experience in the field, especially in the region of Madagascar, where I've been going for many times to do actual work. And today, this session has really the aim to create this feeling of belonging to a community. We will have a variety of speakers and experts from different fields, ranging from NGOs to organizations, to research institute, and also companies. And the goal of this session is really to present the results and the improvements that have been made, the progress that has been made over the last year and a half since we met in January in Frascati. It will be nice to see how much work has been done since then, and also in the frame of building a capacity. Stakeholders often have different reasons for participating into actions and activities. Through capacity building, we aim at developing a common vision, building a sense of collective ownership and commitment. So what is the role of responsibility and capacity building? Empowerment. So capacity building really aims at empowering people locals, individuals, research institute companies, so that they can fulfill their needs and they can become autonomous. So with this introduction, I would like to leave the floor to the first speaker of this session, Lorenzo. So Lorenzo Pezzati is a climate change and sustainability specialist at Cucula, a non-profit organization working on climate, environment, and social equity. He contributes to research and knowledge sharing on resilience and community-led solutions. His work bridges technical analysis with policy dialogue, with a focus on integrating environmental, gender, and social considerations into sustainable development strategies. Today, he's representing Cucula, and Google has been one of the users of DPSDL platform, which is the Deep Earth System Data Lab platform that will be presented in the next session more in depth. Particularly insights from some variable and data coming from these platforms have enabled Cucula and the team to better plan their activities in agroforestry in the north of Madagascar. The floor is yours, Lorenzo. Thank you for being with us.
Thanks, Loretta, for this wonderful introduction. Good morning, everybody. As Loretta was saying, we are one of the users of Earth observation data at a very small scale. We are a very small NGO. I would say we are beginners in the use of Earth observation data, but I'm here today to tell you a bit more about our experience. It has been very inspirational to hear all of the developments that have occurred in this space in the past few years. As Loretta mentioned, we are an NGO, which was founded by a group of environmental engineers. We work in the domain of sustainable development, and our aim is really to set up projects in urbanized and rural contexts that can then be handed to the local population. So the engagement with local communities is essential because we want them to be the owners of the projects that we set up. Just to give you a brief outline of the context in which we work, we operate in Madagascar, in northern Madagascar more specifically, where we see a very fragile health system with poor sanitation. To top that up, we are seeing more and more climate hazards impacting the region. Strong tropical storms have been hitting the northern part of Madagascar, more intense, more frequent. This leads to a number of issues, including food security. The life expectancy in the country is quite low, 65 years for men and 68 years for women. As I mentioned earlier, in urbanized contexts, we see issues related to domestic air pollution and to very scarce waste management practices. While in rural contexts, we operate in areas that have low access or no access to electricity. Normally, it's intermittent. Low access to water. Open defecation is a very common practice. And in general, when it comes to health data, there is basically no health data that we can acquire in situ. Having said this, the domains in which we have been working in the past 6 years are the domain of agriculture, WASH, and nutrition. There are issues, as I mentioned earlier, related to food security and malnourishment. So we try to tackle that with these types of projects. We have been involved in the production of cook stoves with the aim of substituting the more traditional methods of cooking, which are usually tripods where wood is burned underneath. And of course, this creates huge issues indoor air pollution, where women and children breathe in all of the particulate matter and all of the other pollutants coming from the combustion of wood. And we're also trying to find substitutes to the fuel that is used for cooking. And we're trying to use organic waste in order to create some briquettes that can substitute the wood, which is also a major cause of deforestation in the region. Now, the project which we targeted for the use of Earth observation data is called Taninketsa. It means fertile land in Malagasy. This is an agroforestry project whose aim is to promote the economic and social empowerment of women and the improvement of food security in the villages where we're operating. Again, just a small parenthesis on the context that we're working in. This is an area of Madagascar where a lot of intensive farming is occurring. However, this farming is dedicated to cash crops such as cocoa, coffee, and vanilla. So the people that actually live in this region are not benefiting directly from what they produce. There is no culture of having your own orchard so that you can feed yourself and your family, which means that most of the vegetables and the fruit that is consumed by people is imported and hence becomes quite expensive, leading to the fact that many people cannot afford fruits and vegetables, causing unbalanced diets and malnutrition. And the role of women is primarily to cultivate rice for family consumption, but that's it. That's the only crop that is consumed. So with this project, we aim to equip women with sustainable agricultural skills and create women-led cooperatives for the cultivation of locally sourced fruits and vegetables. And this is where Earth observation steps in. During the past 1.5 years, we have had access to an online platform called Deep ESDL, which Felipe is going to present in the next session. You can see in the bottom line, I'm sorry I couldn't put them much bigger, but the organizations that are involved in the creation of the Deep ESDL platform. We had close cooperation with the GMV and the Plymouth Marine Laboratory, and of course with the European Space Agency. So we gained access to time series of land surface temperature, both for day and night, covering the time period from 1995 to 2020. Of course, this type of data can give us ideas of when crops are more stressed, when we see increased evaporation on land, and what conditions are more favorable to the spread of diseases. In addition to land surface temperature, we also got access to data on cropland areas and to irrigated and rain-fed areas, which are quite fundamental for us because they give us an idea of which areas are more vulnerable to water shortages and drought. In practice, that's the irrigated versus rain-fed layer that you can see. In practice, what this type of data can tell us as an NGO operating in the agroforestry domain is how environmental stressors can then turn into health risks that reduce the labor capacity, that hinder food security and the income stability of our cooperative. We can see from trends in the land surface temperature for the day and for the night that there are periods of the year where we see warm nights that are also paired with warm days. This, of course, can lead to increased mosquito survival and shortened parasite development cycles. In practice, this means, first of all, an impact on the health of the members of our cooperative, higher malaria risk and transmission of other diseases, but also, of course, an impact on crop management because of the faster development of pests. Another example of the use of Earth observation data is the use of the irrigation map paired with daytime land surface temperature. This gives us an idea of which are the moments of the year where we see more evapotranspiration stress. Again, this has an impact on crop management because there might not be sufficient irrigation for our crops. And of course, this then turns into a risk when it comes to food security and nutrition, because the families that are dependent on the harvest might have shortages of food and have reduced dietary diversity. Now, we are not just users of Earth observation data, we're also collectors of data. As engineers, we love to measure things. So on the field, in situ, we have experience in collection of physical samples of water, biomass waste, soil, etc. We are able to make certain types of analysis on the field. We have weather stations. We use GPS mapping, especially for our orchards. It's quite important to know exactly what is the area that we are covering. We use questionnaires to collect household data. And we have also collaborated with other local NGOs and international NGOs in the medical domain to collect health data, especially when it comes to the nutrition of the population. I think I'm out of time. That's me, and very happy to answer your questions if there are any.
Perfect. Thank you, Lorenzo. You're perfectly on time. If there are any urgent questions now, we can take them. Otherwise, at the end, we are also going to have some time for questions and discussion with everyone. So, thank you very much for this talk on giving some insights how you're using Earth observation data really in the field. So now it's my pleasure to invite Sean Schwager from SpeedyCom to join us on stage. So Sean leads the Data Science and AI Services Unit at SpeedyCom, developing innovative AI and Earth observation-driven tools for global health early warning systems. And they are also winners of the Hackathon Acceleration Package. So we are very keen on learning what happened since you won the hackathon.
Perfect. Thank you very much to the panelists and everyone here today. It's a pleasure to speak with you all. I'm a last-minute substitution. It was going to be our CEO, Hamza, speaking with you here today. But thank you to Isa for the flexibility in allowing me to join you instead. I'll do my best. So this idea was born from the hackathon that Isa hosted a couple of years back. Our team was the one who won. You can see them here today. And I was then brought on shortly after to operationalize their initial concept. The concept was quite broad, but with a clear mission. They wanted to select a country with a high malaria burden and apply advanced AI and machine learning techniques with Earth observation data to develop a true malaria early warning system that could be scaled and operationalized where it's needed most. Now, cognizant of the scope of this session here today, that it is on capacity building and stakeholder engagement, I'm going to speed run through the slide deck that is largely covering the technicalities of the system so that I can get to the elements around capacity building and stakeholder engagement, as I feel that it is crucial and pertinent to this topic. So after the hackathon was won, we had to get to work figuring out how to actually implement this and exactly how we wanted to go about it. Thankfully, we had a relatively good starting point. The company I work for, SpeedyCom, had developed our own data mesh implementation called SpeedyMesh. This was meant to be a federated data governance architecture that employed concepts such as data as a product and to address concerns such as data sovereignty and ownership of data across a wide variety of stakeholders. Early Warning for Africa was another in-house tool that has been piloted currently, which is the last mile and delivery of early warning system reports. So we already had largely speaking, the meat for such a system. What we lacked was an innovative modeling architecture that was suited to the operational constraints and needs in Africa. We also selected a specific country at the time, which was Ethiopia, given the malaria burden at the time. And as I said, this is when I joined the hackathon team. And full disclosure, I am a development cooperation professional by trade. I've been in data science for the last, I'd say, 5 years maybe, and working in digital health and Earth's observation for only the last year. So I felt like I was stepping into a very, very new world. And that's me in the middle, you can see, looking a little bit confused. And I wanted to understand what the landscape was. And it really seemed like on the one side, you had these highly parameterized mechanistic models, largely fueled by exhaustive field team collection of data and sampling methodologies. And it really seemed like the gold standard of academic fidelity. However, in operational settings, specifically in low resource environments such as Africa, often hard to scale and implement cost effectively. On the other side, we had deep learning techniques. These are quite popular in a lot of modeling settings in Africa. Mainly LSTM models are often at the cutting edge, and for a good reason. As I said, collecting high quality data to support these mechanistic models can be expensive. And deep learning techniques allow you to not necessarily require these very big competent teams of professionals. You can simply take the data and allow your model to try and do that work for you. However, the issue with those techniques is they're only as good as the data that's provided to them. And as is the case in a lot of real world settings in Africa, you either don't necessarily have data at the right resolution or not as consistently. Often the best quality, highest resolution data you have will be at a district level, or if it's sub-district, coming from hospital input data. And that creates what I think we identified as the central operational limitation in a practical setting, which is this resolution mismatch. I have here 2 excerpts that I thought were particularly insightful on the topic to show that I'm not just making things up on the spot. This has been identified by a few research papers recently as really a central constraint. And the basic idea is this. In deep learning, specifically supervised learning, you want to largely have some agreement between the inputs and the outputs that you're measuring. However, when most of the aggregated health data is at a district level and most of your Earth observation data is at a considerably better resolution or available at a considerably better resolution, it creates a tension in the supervised learning process that is usually resolved by aggregating the rich, high-resolution Earth observation data up to a district level. Now, this can be incredibly effective in informing district-level modeling to support efforts like procurement and purchasing of bed nets and other intervention measures. But in terms of distributing those measures to the actual places where they're needed most, the areas within the districts leading to the majority of the burden, you would need something with a bit more specificity. So we went about asking a question: could we overcome this resolution mismatch? How could we, in the absence of lower resolution malaria incidence data, try to operationalize a supervised learning algorithm that wouldn't require the inputs of field teams and dedicated staff that the mechanistic models would, but that would also be able to overcome this resolution mismatch? And so we borrowed an idea from another field, agricultural sciences. In crop yield estimation, you often have a similar issue where you don't know the yield per crop, but you do know the yield of a farm. And the Earth observation data provided can give you insights into the individual crops at a much, much lower resolution. So they often use some form of multi-instance learning, which I'll get to later. But before that, and I'm going to go through this quickly because I want to get to the rest. I'm cognizant I've got 3 minutes left and I want to get to the rest. We are, unlike a lot of the approaches you would have heard during the week, not using gridded inputs. We've elected to go for graphs. And there is a lot of background to this already. In the wake of the COVID-19 pandemic, epiGNN networks modeled COVID transmission across cities and towns using graph-based networks. And the reason we've elected to go with graphs is due to this concept of spatial adjacency. Traditional graphs imply adjacency as what is physically close to you in physical space. Graphs, on the other hand, can determine adjacency more flexibly via edge weights and adjacency matrices. You can learn the concept of what it means to be close to something, not in terms of physical space, but in terms of ecological similarity. Personally, I think the ecozone reports and techniques that you may have heard about earlier in the week are incredibly exciting to me. I know WERS is leading the charge there. And I think that would be an important step towards shortcutting and instantiating the graph network that we hope to use. I wish I could go into it in more depth, but I'm cognizant of the time. This is maybe a simple analogy to explain why a graph may be more appropriate than a gridded structure. If you think about how a rumor may spread through a town, I could either tell the person next to me, who could tell the person next to them, who could tell the person next to them, and so on and so forth. But a more realistic implementation would be that I tell my sister, who goes to a college and tells her classmate, who tells her professor, who tells his dentist, and so on and so forth. We spread rumors via social networks, and similarly, malaria transmission is spread via ecological networks, not necessarily just fixed spatial adjacency. I'm going to skip over this and get to maybe the core, which is, as I mentioned earlier, how do we attempt to resolve this resolution mismatch? And really at its core is this idea of multi-instance learning. So in a traditional supervised learning problem, you may have a huge database of images of dogs, and you label them dog. In multi-instance learning, it occupies a space in between supervised and unsupervised learning, whereby you treat the instances as a bag. And you can approach that in a number of ways. You could either say, if a single instance in the bag is of a certain type, you label the whole bag as that type. You see that, for example, in medical imaging with cancer. If a single cell is in a medical image is determined as cancerous, it's labeled as cancer. And similarly here, you may have been distracted by all the cute dogs, and you may have missed that in the middle there is a cat. And this would be an example of multi-instance learning in application. However, multi-instance learning and the complexity of the graph network that we're going to be implementing does create a major constraint, namely model capacity. I've put the textbook definition there on the left, but the image on the right, I think, is a better representation of the issue. Models that are strong and sensitive enough to detect the type of fine-grained ecological signals that we're aiming for are also sensitive enough to invent patterns. They see signals everywhere, and they will start to interpret the noise that is associated with the incomplete data that we're trying to operationalize a solution to as being some signal that of true malaria transmission. Yes. 1 minute. Okay. So yes, as I said, the stack is built. I mentioned Speedy Mesh and Early Warning for Africa earlier. We have the infrastructure. The modeling layer is really the final step that is still abstract and theoretical and would need to be determined by testing once we gain access to data, which has been difficult. And then finally onto the core capacity building efforts. I've put here just a number of ways that ESA has supported us via way of the acceleration phase, and that we have then in turn tried to pay those efforts forward. We've offered internships to some of our in-house staff to also work in the vector space project. And simply the fact that I'm here with you today is a testament to capacity building efforts by ESA and others. As a development cooperation specialist who moved into data science with no public health or Earth observation knowledge, the fact that I can speak to you here today is really a testament to the efficacy of capacity building in this field. And I thank you all. Yeah. Last one.
Thank you very much, Sion, for this, your inspiring presentation. Are there any questions before we move to the next speaker? Okay, so I'm honored to present the next speaker, Barbara Alessandrini. She is, since 2020, the head of the capacity building department at the World Organization for Animal Health, which is our host those days. Together with her team, she contributes to strengthening the veterinary services by ensuring the relevance and impact assessment and capacity building activities for the members. She is responsible for developing and management of a capacity building strategy in line with the members' needs. Today, she will present all the work that has been carried out by her team here at WOA. Thank you very much.
Thank you. Thank you very much. Good morning, everyone. So, yes, today I want to focus on how we have worked in the last 4 or 5 years to make better use of the immense quantity of data that we produce with a program, the PVS Pathway Program, which is a program that was born to evaluate performances of veterinary services and provide recommendations from independent external experts for improvement. These reports, until a couple of years ago, were PDF files that probably were thrown or stored somewhere in shelves, but with lack of analysis, lack of use. So we wanted to develop a system that allowed us not only to extract quantitative data, but also qualitative data. And starting from that, our adventure has started, and we are now moving very much ahead and integrating and developing and creating new tools that we hope will be helpful for our community of veterinary services in our members. So our capacity building system serves governments, health systems, and individuals. Individuals, because in our capacity building system, we have a training platform that develops not only e-learning modules, but also competency packages with definitions or the competencies that are required for veterinary services workforce to perform adequately in the different sets of domains, of technical domains that are needed to implement correctly the WOA standards. With the targeted support activity, we support the development of global health systems. So One Health is very much included in these efforts with programs that go from support for legislation development to public-private partnership, workforce, laboratories, and One Health integration. No, sorry, puff. Okay, so this is the cycle of the PVS. From the original function of supporting analysis of capacities of veterinary services, we have moved the narrative towards a system that can facilitate monitoring and evaluation of progresses. Because starting from an initial evaluation and with the support of the planning phase, in which we have tools for identifying country priorities and support budgeting efforts for priority need oriented investment, we have transformed the program into something that is able to demonstrate the impact of the activities that countries put in place to better implement the recommendations and therefore facilitate the strengthening and the improvement of the capacity of the veterinary services. And the digitalization has followed this process. So according to what we want to bring, where we want to bring countries, we are now providing progressive implementation of the evaluation analysis capacities, as well as all the other components of the program itself. Let's make an example. For the purposes of this conference, it's a little bit small. I'm not so sure I can read everything here, but allow me to change the display setting. Okay, now it's better. I can read better. Oh. I think it will appear there. I have created a problem. Screen sharing has stopped because the external display is disconnected. Sorry. I wanted to read a little bit better, but it's okay. Maybe we can find a way of. Oh, it's okay. No, I can continue like this. I'm sorry. No worries. Okay, let's leave it as it
Maybe
is.
I can zoom.
No, don't worry, don't worry, don't worry. It's okay.
Zoom. So maybe you can
Okay.
like this.
Okay.
It's not on Zoom.
No, let's do it old fashioned, no worries. I can read it from. I have created an issue.
No worries. Everything has a solution. Screen. Share. And now this one maybe. Zoom. No, it was just a presentation. This one. Mm. Yes. Yeah.
It's okay.
But it's not.
No, but now we cannot navigate in here. Because we cannot control the PowerPoint here.
Can you stop sharing and retry again?
Right now you are sharing your screen on Zoom. We can see that on Zoom.
Yes,
Uh,
but the thing is we cannot navigate in this.
Okay. I think you want to
You want to sit?
yes, you want to no, sorry, no, to sit. You know, the mouse is over there. Since the screen that you have here is you have to think like it's there. So you can move the mouse like this if you want.
Yeah, but
And
how
then-
can you go back to the original?
Yeah, you want to go back to
Yes. Let's remove this lamp.
like that. And
But how to
okay,
go
I think that's good.
Yeah.
You want to be that way?
I want to continue controlling the presentation. So where should I go to do it?
Can she move back and see?
You should just go. But I cannot see it anymore on the screen. Just make it bigger here. Make it bigger here. No, but this is. You can't see it here. If you make it
It's already
bigger here, you
presentation.
will see it here. Make it bigger here.
It's already in presentation.
But it's not what it's on the screen. This is another file.
So, you want to
I would like to go back to the, no, I want to go back to the simple presentation.
while you were
I want this file to be shown here if possible.
Which file do you want? to
Okay.
do?
This is the file.
Is it not the one that is?
It is,
Yes,
but where is
we
it?
cannot see
We
it.
cannot control it
Oh.
from here. So maybe if we stop sharing and restart, maybe. I let
Let's
it.
see. No, it's okay. So where is the file?
It's this one.
This one.
Mhm.
So.
Can you zoom out? No.
Maybe close the presentation and reopen it.
Which one?
This one.
So.
You maybe close it completely and reopen it. Just close it there.
Yeah, I can tap this one. Okay. With this one?
Alessandro.
No, it's day 4. Session 8.
no,
Go
you're in
back.
day 3. I need to go to day 4.
Go back. Exactly, day 4. Session 8. Number 3.
Number 3. What is the
To
zoom?
screen share.
Let me share the zoom first. Second screen. And then a screen share.
Thank you.
Wow. What is it?
Okay.
What is it that you wanted to do?
Nothing.
Okay.
Nothing. I wanted to read this super small, but I will read it from the screen. So going back for the purposes of this conference, I had selected some of the critical competencies that are evaluated when we go to countries. And when I say critical competencies, I mean functions of veterinary services. And you can see that I have chosen, for example, external coordination, including One Health coordination, communication, sustainability of national laboratory system, emergency preparedness, consultation with stakeholders, etc. And you can see some of the results, and you can see that among the 144 countries that we have until now evaluated, only a small percentage has the minimum capacities quantitatively assessed, the minimum capacities in these specific functions. This is an indicator, and of course, this is a global figure, but you can do it per country, per group of countries, per regions, and you can get into very much more details, which I don't have the time to show today. You can also see progresses over time. So when I was speaking about monitoring and evaluation of progresses, when countries go into follow-up evaluations, they can also measure their capacity to improve from a quantitative perspective. But thanks to language learning modeling, we have also exploited the opportunities offered by artificial intelligence to extract qualitative information from the reports. We have done enormous efforts to make it working in the 3 languages, in the 3 official languages. So no matter where the reports come from, no matter the language, the original language of the report itself, data are analyzed in one single setting. And we have also worked a lot to clean the language, so to associate synonyms, etc., in order to facilitate the machine learning process. And you can see that you can also highlight strengths and weaknesses of veterinary services for the different functions that I had selected. And again, you can go deeper and deeper and deeper up to going to the full description of the original test included in the recommendations themselves and into the strengths and weaknesses themselves. So with this capacity, we have worked in the last year to support countries to change completely the use of the system they have done until now. And we have worked with them to support their capacity to prioritize investments and also to create dashboards, narrative-oriented language to the different political and administrative authorities to put efforts on evidence-based investment and case studies. This has dramatically increased confidence by donors, by investors that have finally seen the capacity of countries to demonstrate how they are implementing and how they are using money that in most of cases is also public money. And it was not possible until a couple of years ago. We have progressed so much that the pandemic fund has included 17 indicators coming from PVS in order to evaluate the results of the pandemic funds project. But this is not all, because we have also worked, and it has been really a work led by Chadia and her group to which we have participated. We have also signed an agreement with the World Bank to use PVS data to define indicators in the framework of a risk need metric that has been methodology that has been created to evaluate project proposals, so that PVS indicators in order to evaluate animal health system capacity, animal health system maintenance and improvement in the proposals that are presented now in the new calls that are being launched. And this is exactly where we wanted to go, because this is the best way to benefit from the efforts of the PVS data.
1.5 minutes left.
No, we spent 5 minutes for the
I
system.
stopped it.
Oh my God, 1.5 meters. I try to. Okay. Another activity that we have now performed with the data available is to facilitate countries making their own self-assessment about their progresses. We have launched this self-assessment that goes in each and every recommendation to evaluate how it has been implemented. And the system allows to understand, this is the pilot that we launched in Asia Pacific, for example, and we saw that 78% of recommendations requested additional resources, 47% obtained resources, so that we can now demonstrate that the PVS data are used as we wanted in our theory of change. Members, donors, and WOA use information for prioritized investments. The same for human resources. So if you look at the critical competencies related to workforce development, you can have understanding of members' capacities. And together with this, we have developed something that maybe is more of interest for this audience, which is what we have called VetWhat, which is a tool that allows to identify quantitative needs of members in terms of veterinary workforce. This is a tool that has been created and will be piloted before the end of the year, that is based on a model that includes pre-populated data, it includes country-specific inputs, and it provides quantitative outputs related to the workforce need for the different workforce category for the different veterinary services activities. Very important is that as it is based on a modeling, simple modeling system that works also in contexts where data are poor, it's also very much important to consider the last part, the contextualization, in which we request expert opinion for contextualization and final use. Third, and I finish here, third step is the learning need assessment tool. Again, starting from PVS data that facilitate context analysis and passive data collection extracted from PVS, and based on the job descriptions and competency descriptions that we have in the training platform, we have created also an information system that is able to deliver customized surveys to collect data, and active data collection and passive data analysis can create targeted learning need assessment and recommendations for training development. So I need to stop here, just want to go to the conclusion, which for us is that there is no progress and development without clear understanding of needs, challenges, opportunities, priorities, and there is no resource availability, of course. And investments are successful if they put human resources at the center, but also if countries, and this is what we are trying to do, learn that we are in a continuous improvement system in which monitoring and evaluation are necessary to demonstrate impact. Sorry for the delays, and thank you for your attention. I don't touch anything.
Thank you very much on sharing insights on this very systematic approach to evaluation and learning. I think it's very interesting to see this approach. Now it's my pleasure to ask Jorge de Rio Vera to come to the stage. He's from the United Nations Office for Outer Space Affairs and advances global use of space data and technology for health. And he's also a key partner in the Space and Global Health Network.
Thank you. Thank you very much. Thank you, Caroline. Let me get accommodated. Okay, so good morning, everybody. My presentation, it's about some need that I detected when we were having discussions this week. That is about how do we transform all the discussions that we are having into policy. And I'm going to answer that from the United Nations perspective, actually from the office perspective, the United Nations Office for Outer Space Affairs, and what we are doing with our member states. Just very briefly. Okay, so the office was established long time ago. It was after the launch of Sputnik. That was in 1957. And we have existed since. now with the increase of space activities by member states, we are also increasing in the work that we are doing. We are increasing in mandates and in things that we have to be looking after. What is not increasing is the number of people that we have. That's the composition of the office in January. Now there is, from that picture, there are 5 people less. And next year, unfortunately, there will be more people because the UN Secretary is undergoing a liquidity crisis and 20% of positions have to be eliminated. So we will be even less with an ever-growing mandate, but we'll manage. What is the office doing in terms of policy making? Well, the office is supporting the Committee on the Peaceful Uses of Outer Space, which, I mean, you can see one of the sessions there in that picture, where member states are discussing about peaceful uses of outer space. And that's everything you can think of concerning outer space. The committee has 2 subcommittees, one that is focused on science and technology and another one that is focused on legal aspects. Both are reporting to the committee, and then the committee is preparing a report that goes to the General Assembly, and there is a General Assembly resolution every year on the peaceful uses of outer space that is summarizing the discussions. Question, so I get you awake again. How many member states do you think the committee have? A number. I mean, considering that United Nations has 193 member states. A number? 50, okay? 183, okay? Okay. The committee is member states apply for membership, actually. You are not automatically a member if you are a member of the General Assembly. But I like the optimism. No, actually, we are not that low as 50. We are 104. Well, we are. They are 104 member states represented in the committee. And you see the distribution of member states by the UN geographical groups. So you see representation from countries that have a lot of space capabilities and countries that are starting space career because they have a lot of interest of what space can do for development. Okay, so how do we get mandates? How does the office is getting mandates and how we are implementing things? So as I said, one way is General Assembly resolutions. On the context of health, there are 2 General Assembly resolutions that are mentioning health. Actually, the recurrent one that is happening every year is mentioning health, but there was in 2022 one General Assembly resolution that was entitled Space for Global Health. So that's a policy outcome of years of discussion. And what is that saying? Well, that is saying that there is something that is called the Space and Global Health Network that should facilitate exchanges between countries, United Nations entities, civil society, and bring it to the committee. So member states that are represented in the committee are aware of what's going on. So that's something that exists. If there is that's a mechanism to transform science into policy because it's reporting to the committee. Every year there is a report from the Space and Global Health Network in the committee. Okay, then out of those resolutions, the office had got a mandate of implementing capacity building, and we had 2 conferences. One that was global in Geneva in 2023, and another one that was regional for Latin American and Caribbean in 2024. We were planning another one this year focused on Africa, but the liquidity crisis that we are going through has not allowed that to happen, and we'll see if we can continue with that effort. But those conferences are creating recommendations that are put forward also to member states. And recommendations I mentioned, the first day, there was a recommendation on interoperability. We have to work on interoperability between Earth observation and health systems. We have to work on foundations. We have to create a set of space-based essential health variables, not only to understand what is needed, so space agencies can plan missions, but also to understand how we are driving capacity building. If we identify which are the variables that are important for health, we can go to countries and explain to them, these are the variables. You can create systems that are based on these variables because this is going to help you with X, Y, and Z. There was another recommendation on creation of a space and global health curriculum, and that's well going through. And there was another recommendation to create a long-term strategy for space and global health. The conference that we had on the Americas had a recommendation on creating a virtual observatory in space and health for the Americas. That has not been implemented, and we have to see how we are going to implement that. There was another recommendation that probably is important for space agencies, that is to try to work better on population data estimates. I mean, there are layers, but I mean, there was a recommendation to make those layers better. And there is another recommendation on open source and creating geospatial toolkits, so that increase uptake of these tools. That is something that is done through you, the community that is working on space and global health, especially the science community. And there was, well, the ones that are tick, I'm not going through those. There was another recommendation that is very important and is building up on what Barbara was mentioning. It's very important to have impact analysis and cost-benefit analysis. It's not enough to have science. It's important to demonstrate the societal benefit and the benefits in terms of cost that those solutions are bringing. Because maybe the solution that doesn't imply working with space is better. We have to understand how better it is space. I mean, of course, we are space people. We like space, but maybe it's not the right tool in some cases. Then we created the strategy. That was a recommendation. The strategy is talking a lot about capacity building. It has 3 priorities, one on institutional strengthening, and there are policy frameworks to be developed. The strategy is going to run until 2035, so we have time. There is a lot of knowledge and awareness raising, which is part of capacity building, and there are mentions there about understanding of the intersection of space and health. And there is a mention to telehealth that we have not discussed very much here, but there are many applications of space that are not coming from Earth observation applicable to health that need to be exploited, and we are working on that. Then there are another priority on capacity building, working at 2 levels, individual level and organizational level. So for you, takeaways, if you want to get into this policy mechanism and present these findings to member states in COPWAS, the way that you have is, 1, you go to your national delegation and you say, this is important, please, please, please make the others aware. The national delegation will decide. Another way, Space and Global Health Network, you become part of the Space and Global Health Network, you discuss there in the different working groups and the different meetings, and that will be summarized and reported to the Scientific and Technical Subcommittee of COPWAS. Or you participate in conferences or workshops that we are organizing, and those are creating recommendations that are also fed into COPWAS and the subcommittees. I'm going very fast, so I have 2 slides. One thing that I identified when I was going through, we have been working on things that are related to health in reports. We create reports to basically raise awareness. We had one report on space supporting sustainable development goals. That was a few years back. A couple of years ago, we had another report that is mentioning health, that is about which are the challenges that the space can support in a world of 8 billion people, because we are over 8 billion people. And this year we published one on space technology for agricultural development, but there is nothing preventing us to publish one on space for health. That's something that we can do, and we can work together on that. That's basically it. The one recommendation that I have for you is join the Space and Global Health Network to make your voice heard. Thank you.
Thank you very much, Jorge, for this very interesting presentation. Are there any questions before we go to the next speaker? There will be also a panel discussion later led by Jorge. So in case you don't feel like sharing now your questions, you will have an opportunity later. Thanks again. And it's my pleasure now to introduce Caroline Perrin. She's a director at the Geneva Digital Hub, Digital Health Hub, at the University of Geneva. She holds a PhD in biomedical sciences and a master degree in information system management. She's specialized in the intersection of technology, strategy, and policy, with particular emphasis on implementing scientific guidelines. Her research focuses on how digital innovation can enable health systems to learn, adapt, and improve continuously. She will present today the work that has been done by the Digital Health Hub at Geneva and the collaboration initiatives. Thank you.
Sorry. Okay, sorry, it's a PDF, so there has been some. Good morning, everyone. And first, I want to start by thanking Stefano and Isa for bringing us all together here. I think it's a great way of exchanging, of learning about what the others are doing, and in a way, a great, and of course, also to WOA, to reunite us here and to bring us together and to have capacity building and action, I would say. Sure. Perfect. Thank you. Okay. As we all know, health systems today face major challenges, and I think it's something, sorry. It's something we have heard over the last couple of days, from pandemic to climate change to disasters to inequities. There's a lot of challenges that need to be addressed, and space technologies such as Earth observation, AI, and so on can support addressing some of these challenges. But there is a gap. Many users are not yet aware about the potential users or the possibilities, or they lack the training to use these platforms that exist or to put them into practice. And that's one of the reasons why the Space and Global Health Network was established that Jorge had just mentioned. The Space and Global Health Network was coming out of this UN interorganizational process. It's hosted by the Geneva Digital Health Hub. It's a multi-stakeholder network bringing together space agencies, UN, academia, NGOs, and private sector. And our mission is really to strengthen capacity building, knowledge sharing, and innovation. So how do we translate these mission into practice? Through capacity building tools. One way we do that is through communities of practice. So multi-stakeholder, peer learning, networks where we can learn from each other, where we can share best practices and use cases, and where we can link projects and partners. But these networks or these communities of practice are not only there for exchanging, they can also be very efficient in actually developing solutions that can be to the benefit of the wider community. And that is, for example, the curriculum that was mentioned, I think, by Awa on the second day, as well as by Jorge just before. So the Space and Global Health Network developed the first Space and Global Health curriculum that is about to be published and finalized, that ranges really from Earth observation to AI, telehealth, and policy. It covers a wide range of topics. And we're not only developing the curriculum, there's also a plan to develop a MOOC, so we can really bring a capacity building around what Earth observation, what space technologies can do for health to a variety of different stakeholders. along these more structured approaches, we also use hands-on approaches like the hackathon that was mentioned a few times. So hackathons are really hands-on formats to bring together different stakeholders that maybe in a other setting not necessarily come together and co-create, and they can co-create solutions, and that's what we have seen with the last hackathon. They are a great way to break silos and innovate quickly. Then it's important to follow up with this innovation, and we are very grateful to ESA, who has provided the acceleration package to, bring these ideas to really a pilot and not only keep them at the conceptual level, because that's something that we often see after hackathons. And finally, we support sustainability and capacity building through platforms like the Implement Home that includes, for example, the World Health Organization Digital Health Atlas. This is a tool that is allowing you to document what implementations exist, what have been done, what were the challenges, what are the best practices. The idea of this tool is really to understand what already exists, how can we learn from previous implementations, and how can we find synergies between different or already existing solutions. As Speedycom has explained before, we are also using graph-based database to allow us to do a little bit more advanced analytics and to bring really diverse kind of data sets together, and not only bring implementations, but also bring scientific publications and other kind of data into this. And I will stay on time and really finish with a call to action. So building capacity is not only about training, it's also about creating network tools and opportunities for collaboration. So invite all of you, as Jorge did already before, to join the Space and Global Health Network. If you're interested in, bringing your lessons from the field, bringing insights to a bigger audience, we invite you to contact us, to reach out to us, and to contribute to the MOOC that we are operationalizing end of 2025, 26. And we also invite you to collaborate via the Implement Home and the Digital Health Atlas. So go to the Atlas, put your projects in, so others that are doing similar interventions can see what has already been done, can find synergies, can connect. Thank you very much for your attention. You can find some links here. Don't hesitate to go to them to get more information. And of course, you can also reach out directly. Thank you.
Thank you, Caroline. Are there any questions from the audience? Okay, then we leave the floor to the next speaker. She is connected remotely.
Hi. Yes. Good morning.
Hi, yeah. Okay. So I will say a few words about our next speaker.
Yes.
Yonilda
In the
Kushka.
meantime,
Yeah.
I don't know if you can hear me.
Yes, we do.
It says the host isn't allowing multiple presenters sharing for this webinar. So.
We stopped sharing. So can you try again?
Okay. Yes, better. Thank you.
Okay, so Yonilda Kushka is the next speaker. She is currently a user engagement and partnership specialist for the Copernicus Atmosphere Monitoring Service National Collaboration Program based in the European Center for Medium-Range Weather Forecast Offices in Bonn. And she also leads the thematic applications of the Copernicus Health Hub. This was already introduced by our keynote speaker today. So Yonilda will deep dive into the Copernicus Health Hub with her presentation. Thank you, Yonilda.
So good morning, yes, and thank you for this opportunity. So I'm the first presenter online today, so I hope everything goes fine. You see my screen, full screen, right?
Yes, we do, yeah.
And I can go ahead. So good morning, everyone. So I'm going to use my 10 minutes to present to you the Copernicus Health Hub. And I will start by saying, align with the previous speakers, that this is the best of effort initiative. So due to the lack of the systematic support to such efforts recently. So the Copernicus Health Hub was officially launched at the EU Space Week in Seville in November 2023, so roughly 2 years ago. And that was an important milestone for the Copernicus Earth Observation Program. So the Health Hub is one of the several Copernicus thematic hubs that aims to support users in specific domains, and in this case, the health domain, in navigating the entire Copernicus services portfolio. I will reply to 4 questions that you might have about the hub. And the first one is, what is the Copernicus Health Hub? So it's a comprehensive platform. It's endorsed by the Commission, and it's created by Copernicus to provide implemented by CAMS, Copernicus Atmosphere Monitoring Service, to provide user-centered, targeted information on environmental factors that affect citizens' physical, mental, and social well-being, aligned with the World Health Organization definition of what health constitutes. So as I said, it's implemented by CAMS, and it aims at constituting an interdisciplinary collaborative meeting point where health and environmental science communities come together through the power of Copernicus services. I need to highlight here that this interaction is a two-way interaction. So Copernicus services provide their products in the prism of health applications, and then we expect from the community to come back to us about the usability and fit for purpose of these products, and also recommendations and suggestions for improving them. Why was it created? So we know that Copernicus is a perfect example of user-driven approach to leveraging EO-based products, including satellite imagery, climate models, and atmospheric monitoring, and offering, I believe, unprecedented insights into environmental drivers of health outcomes. But there's an issue, there's a challenge there. It's translating this wealth of data into actionable intelligence for policymakers, healthcare providers, researchers, and other relevant communities, of course, including private citizens also. And the Health Hub, the Copernicus Health Hub, aims at bridging this gap and bringing together the health players to connect, share, inspire, and collaborate, each contributing a piece of this big puzzle, stating what health is about and how environmental stressors affect it. So the third question is, how does it contribute? So as I said, the Copernicus Health Hub is designed for a two-way interaction between the communities and the health community and the Copernicus services. And this, for the moment, is being done through 3 main axes: highlight cutting-edge products, data sets, and tools, meaning applications, and indicators provided by the Copernicus services to assess the forecast real-world environmental impacts on public health, showcase use cases and user stories of successful implementation, and thus help build an active community, and putting in place mechanisms to integrate community feedback on application needs. Training and events are such activities. And the 5 services highlighted here, I will go a little bit in detail later on. So who can benefit from the Health Hub? Is EU institutions and as agencies that inform on health planning and response, researchers and universities, industry and innovators, policymakers and public authorities. The media and general public have shown quite a lot of interest on the Health Hub, and of course, civil society organizations and NGOs. So these are the Health Hub 5 services and the categorization of the products. I urge you to go and visit the healthcopernicus.eu website and take a look at the way that these data sets are structured and what we provide. For the moment, the services contributing are the atmosphere monitoring, the climate change, the emergency management, the land monitoring service, and the marine monitoring service, thus constituting not only direct impacts of environmental stressor, meaning, for example, air pollution and premature mortality, or urban heat stress and premature mortality, but also indirect effects through water and land stressors. So the data sets are accompanied by a description, if you go into the hub, that of the parameters themselves, but not from a technical and scientific point of view, rather from a usability for health-oriented applications. For here is an example of very recent thermal trace app that has been developed by the Copernicus Climate Service, and how this risk of it increases the risk of heat-related illnesses. Another example is the air quality forecast or the long-term air pollution data, and how they can be used to analyze the link between air pollution and non-communicable diseases. The street tree layer information. As we know, urban greenery has impact on health outcomes such as reduced stress, cardiovascular health, etc. And another example for the marine environmental quality and its potential impact on health, especially for waterborne diseases. Sorry. So such successful applications of the data mentioned are described in detail in the user stories, and they include specific use cases that involve direct case of Copernicus data in real world application. So may I use 1 minute here to also mention something that I haven't included in my PDF, but I will send this to you. In the framework of the Africa EU Space Partnership Program, Component 2, Space and the Green Transition, focus on early warning, which is developing space-based services, applications, and tools to strengthen early warning systems for hazardous weather and climate-related events. There's an action named SIWA, Strengthening Early Warning in Africa, that was initiated in January this year with a 4-year implementation period to stimulate the use of ECMWF and Copernicus data with the aim of co-developing impact-based forecast demonstration services and tools in the sub-Saharan Africa with African partners. And I'm referring also to the first presentation of the session. So the CMWF activities in this aspect will be implemented in close cooperation with other 2 African partners, the African Union Commission and the European Organization for the Exploitation of Meteorological Satellites, EUMETSAT. So take a look at the link for those that are interested in this particular region. So here I would like to close by an open invitation to all to share your stories on how you combine Copernicus data with health applications. Visit the website, and then in that website you will see a link where you can input your information, and then we will come in touch with you to discuss the details of your application and feature an article on the Health Hub. And with that, I would like to thank you and thank to all the partners that we've collaborated so far, and we hope to enrich the community in the next years. Thank you very much.
Thank you very much. Are there any questions? No? Okay, thanks. We can move. They're in person? The next ones are in person? Yeah. Okay. Also remote. Okay. So our next speakers are also going to be remote. It's Sinala Netanyahu and Matthias Braubach. They are both from WHO Europe and focus on environment, climate, and health links to strengthen public health strategies. I think, yeah, you should have permission to. Perfect.
Can you let me know if you see the full screen?
We see the slides, but not in full screen.
Okay, how about now? No? How about now?
Not yet.
We do it. This should work. 1 second, let me just reshare it again. Sorry about it. Good morning, everyone. What about? Okay, it looks like very good. Great. Good morning, everyone. My name is Sinai Netanyahu, and until a few days ago, I was a program manager for environment and health impact assessment here at the WHO European Center for Environment and Health. So now we are going to be called the European Center for Environment, Climate and Health, and I'm becoming a senior advisor for nature and health, focusing more on nature, biodiversity, One Health, implementation of nature-based solution, etc. So what I'd like to do today is just to share with you one way of our capacity building methods that we go along in the last several years. We do a lot of capacity building. We do bilateral capacity building, ad hoc capacity building. We support member states on different environment and health topics, can be on air quality, can be on climate mitigation or climate adaptation, working healthcare systems to reduce carbon, working on water and sanitation, we work on contaminated sites, on impact assessment, on nature, etc. But today I'm going to focus on one specific course and to demonstrate how we work through the Bond School on Environment and Health to, how we use that platform to actually go and do a capacity building in the area of nature and biodiversity with member states. So this course has been designed several years ago, and the school has been designed several years ago, and this course I'm going to do together with Matthias Boraubach, my colleague in our center. And we also work together with the University of Exeter that help us to develop this course that I will show you today. So first of all, let's see, I'm unable to move to the next slide, so I'm not sure. I'm not sure if you are able to see the next slide at the moment. Okay, now I can. I guess you can. Hello?
Yes, we can see it now.
Okay,
Thank
very
you.
good. Okay, so actually the WHO European Center receives its mandate to work in environment and health through a ministerial conference that we hold in the area, in the region, with the 53 member states every 6 to 7 years. The last meeting held in Budapest 2 years ago, and member states, the ministries of environment and ministries of health got together and created a declaration. This declaration is for the first time, doesn't look into a silo issues, but it does look into the triple crisis as being defined by the UN system, tackling pollution, tackling climate change, but also tackling biodiversity loss and land degradation. So this is really the first time where member states of the European region decided to put nature and biodiversity as a central element within the environment and health work plan for the next several years. And this declaration is actually having a roadmap that will be in effect until 2030. And we work with member states step by step, helping them to support different commitments. Let it be the global framework for biodiversity that contains a chapter on health, and the recent one contains specifically a chapter on One Health, and many other international and regional commitments that our member states are having, but in relation to nature and biodiversity, and bringing the health argument into account to both sectors. So this is one big platform that, if anything, we can be reported is really about the great multi-sectoral interaction that we have with the member states. So the Bond School itself, we started it in 2019, but it was an on-site capacity building. It was very condensed, 1 week. We covered many topics, and we didn't feel that it's working very well as a capacity building mechanism or platform. So we changed it in 2020, and we decided to go deep dive into courses. What we do in those courses usually, we do several elements. First of all, we focus on specific thematic area. As I mentioned, this time it's going to be nature and health. We also try to bring cross-cutting elements like communication, like inequality, like how to do impact assessment into this course to build it as part of an integrated part. The third element is that we are forming groups and we are asking them to face a problem-based learning scenarios that they have to develop throughout the course, and I will get to that later on. We do believe that there should be a fourth pillar, which is mentorship, but it doesn't always work because it depends if we have graduate or we don't have graduate. As I mentioned before, the aim is really to bring the both sectors together. We try to establish leadership in environment and health at the national level. We try to bring together different perspectives. It's really, really challenging because the European region, when we try to do capacity building, we face issues related to cultural perspective, different regulation in the different subregions, between Central Asia, the Balkan, the Caucasus, the European Union. We face issues related to vocabulary. How do you bridge interdisciplinary issues, the multi-sectoral, the interprofessional? There's lots and lots of challenges that we are facing, even, with language barriers. And we are trying to overcome it throughout this course. And it's really interesting because everyone is learning from, people are learning from one another in a very safe environment and comfortable environment. And surprisingly enough, many times people from the same countries, from both sectors, meet the first time in our bond school. So I'm just losing a bit of control over the thing. Okay. So what is the nature? What is the objective that we have? We try to strengthen conceptual understanding and knowledge and technical skills between nature and human health. We will be covering communicable diseases, non-communicable diseases, mental health, etc. We try to strengthen the knowledge of the importance of nature and the impact of nature-based activities on human health. But we will also integrate the One Health approach, of course, and we will also discuss planetary health because there's lots of terminology floating around, and sometimes we need to bring the context, the relevant context. We are strengthening knowledge of the current risk that environmental change and nature degradation can pose on health. Oftentimes, we tend to paint the green element and nature element with a very pinky picture, so to speak. But no, we need to look into different vector diseases, different irreversible damage that can be done, etc. So we are taking that into account. And looking into, making sure that, for example, when we plant trees within urban areas, we make sure that those are endemic to their region, to their area, and we need to make member states, to be aware of the different diseases that come along with different intervention. The fourth objective is to foster interdisciplinary knowledge exchange and multi-sectoral action through in-depth training models that I will explain later, and to support evidence-based decision-making processes and the need to consider natural environment impacts on communities, but also looking into vulnerable groups. So these lectures, or this course, actually going to start in the 13th of October this year, and it's going to last about 4 weeks. The first week, we're going to cover just, key terminology to make sure that we're on the same page. We're not taking for granted that anyone is knowledgeable enough with the various terminology. So we are trying really to make sure that everybody is starting on the same page. We will introduce concept. We will highlight concept. We will clarify them. We will introduce key policy frameworks that are relevant to the region. Many of them are related, obviously, to the CBD, to the Convention of Biological Diversity, and many of them have many components related to human health. We will also introduce system thinking as a practical approach. How, for example, when you think about greening space within a city, you can also consider encouraging or promoting physical activity. So the system thinking, has to be present throughout the development of this course. Then we will go deep dive into looking into environmental pollution and how it affects nature on climate change and the interaction with biodiversity and the feedback elements. We will look into climate change as a driver to pandemic and zoonotics, and we'll bring the One Health approach over there. We will talk about degradation and exploitation of natural resources. We would then look into the benefits that can be achieved and the co-benefits, but also nature in healthcare systems, how healthcare system can be promoting the nature within the healthcare system in general, or less damaging nature as currently, for example, with medical wastewater, etc. We will look deep dive into nature-based solution based on a joint publication also that we produced together with our collaborating center in Exeter. And we also look into protecting biodiversity for health.
Sinai, sorry, let me just interrupt you. Just in terms of timekeeping, you have maximum 2 minutes left.
Yes, okay.
Sorry, thank you.
That's very good. We will do a little bit of economics of valuing nature and BCI, the behavioral and cultural insight and citizen engagement, and we will look also to the future direction in this area. The last thing that I wish to cover is really related to how we work together. We will divide the groups on different areas, and they will have to focus when they are going to create this national nature strategy and action plan in this problem-based learning groups and solutions. They will actually be divided to 5 groups. One of them throughout the course will be concentrating on nature and flood mitigation. How can we use nature intervention to mitigate floods? Another group will look into how to mitigate heat waves with nature solutions. Another one will look into preventing environmental pollution and non-communicable diseases. The 4th group on preventing emerging diseases, zoonotics, vector-borne, etc., invasive species. And the 5th one will be on creating health systems benefits through nature intervention. So I'll stop with that. This is just one example how we do capacity building here at the European Center at WHO. Thanks. Over.
Thank you very much. Thank you. The problem-based learning approach is really interesting. So thank you.
This ends the presentations for this session. So we would like to ask you if you have any question from the audience. Otherwise, we move. We are a bit late with the time. We can move directly to the interactive panel session that will be chaired by Jorge. For this panel discussion, we thought at having something very interactive. So we hope you will have also some fun. I let Jorge come to the stage and introduce the rules of the panel discussion. Thank you, Jorge.
Hello again. Just 1 second. We are going to do something here to get things there. While we are doing that, you are going to need paper and you are going to need a pen. For paper, we have a solution. Stefano has, Stefano is there. So Stefano has some sheets of paper that have a template on one side, and on the other side, they are blank, so you can use for the session. So if you need, Stefano is going to be distributing them to those of you who don't have paper, because it will be useful. Pens, we don't have. If there is someone that needs one, I have mine. I can borrow it. Okay. So just get your brains into motion, because we are going to be doing things very fast. It might be that there are no enough sheets of paper for everybody. So if you have your own notebook, maybe you can use it and allow for those that don't have a notebook. Okay, so we are hopefully all set. So Loretta, Caroline, and I, we are going to be here helping you. We want to, first thing, I want to remind you of a few things that have been discussed in the previous session. We have been talking about capacity building. It's very difficult to find a standardized definition of capacity building. We came out yesterday during dinner with the definition that you see there, from kids to ecosystem. So it's basically from the grassroots to have a full ecosystem developed in a country that is able to be delivering for the country needs. And it's composed of different aspects. You have policy aspects, industry, science, awareness raising, and you see that, the words are a little bit crumbled because of the translation to PowerPoint in the Google format. But you have there some examples. For industry, you have things that could be helpful, like hackathons, incubators. The word that you see blur is accelerators. So those are things that you can think of to develop an ecosystem in industry. In science, you have, for instance, fellowship or exchange programs that can be helping, right? Now is your task. And that's why I was asking you for paper. Now you are the chief Earth observation health architect of a fictional country called Tulinia. And you have received personally the task from the president of building from scratch the EO4Health ecosystem that will put Tulinia at the forefront in that area. So your mission, if you're willing to accept it, I'm trying to move the slides, but this doesn't obey. Maybe there. Where is the mouse? There. Okay, thank you. So, first task. You have 1 minute. Actually, I'm going to give you 1.5 minutes. We are feeling generous here in the panel. To write down, and that's why you need paper and a pen, all the ideas that you think would make that possible. Your goal is not to rank ideas, to think that ideas are crazy. Don't put barriers at this moment yet. Your goal is to have as many ideas as you can, and no matter if they are long-term or short-term. But you need to have in mind that we are going to be working for a 6-year plan. That's your latest day in the horizon. By that time, Tulinia has to be the leader in the world on EO4Health. So you have 1.5 minutes starting now. No, those are dates. I'm sorry. Those are dates that you don't have to look at. Now you have to think ideas. Don't worry about anything else. You want to get the country at the forefront. Don't think on anything else. What ideas in terms of capacity building would help to get the country at the forefront on EO4Health? As many ideas as you can. Don't just start writing. If you want. I'm going to be a little bit picky. Be individual, work individually. I mean, we want as many ideas as you can. We will be working in groups later. We want all brains in the room to be working. You have 10 seconds left. Okay, there you are. So now you have written a lot of ideas, and probably you are finalizing the last ones that are coming to your mind, right? That's very good. I mean, and you may think that some of the ideas can be crazy. Some of the ideas may be very difficult to realize. No worries, no worries. We will get there. Now, we have to work on the timing aspect of those ideas. I mean, you have a very long list of ideas, hopefully. And now you will have another minute and a half, but now you can take it easier because it's easier, the task, to put them in a time-wise perspective. And that's why you have the table there. If you got the sheet of paper that Stefano was distributing on the other side of the blank part, you have a table, actually, with those dates. Now you have to categorize your ideas in 1 minute and a half in what should be done basically now in the next few months in 2026, what should be done by 2028, and what should be done by 2031. So you get your ideas and you put them in those categories. The table that you have there have some milestones that are important for us because, as we all know, Tulinia is an ESA member state. So those dates are related to the ESA decision-making process. There is, in 2026, of things that are related to 2026, are LPS that happen in June 2025, EO4Health User Forum, as we speak. The ESA Ministerial is coming up in November 2025, and ESA funding from the Ministerial will start from 2026. And you have the same type of cycle for 2028 and 2031. So you can have those in mind when you are categorizing the ideas. So now you have all your ideas, put them in the right timing sequence. You have 1 minute and a half, no stress. You have 5 seconds left. Very good. Now you should have a list that is sorted in time with all great ideas that you had in the first minute and a half that we had today. Now, and that's why I was telling you, don't worry about the ideas you are putting forward, because now you are going to be your own judge. Now you have 1.5 minutes to rank those ideas. Let's say you have 3 ideas in the column in 2026. You have to run them, give them points, which is the best idea, which is the second best, and which is the last best idea. So you have to do that for each column where you have ideas put forward. And you have the magic number, 90 seconds, 1.5 minutes. So you need to come out of that 1.5 minutes with a ranking. Time starts now. Five seconds. You see, now you are getting used to it. I see people already relax with the time. So maybe we put a little bit more pressure. So now you have a ranking of ideas, right? And you have a temporal sequence. Of course, implementing ideas is a matter of opportunities. And sometimes an idea can be very good, but the stars are not aligning and there are not enough opportunities to implement it. So now we are going to look at that. And now you have 1.5 minutes to put next to each of your ideas the opportunity that you see that could affect most that idea or the implementation of that idea. Let's say we have the accelerator. So maybe the opportunities that there is going to be, or sorry, we have a hackathon as an idea, and maybe an opportunities that there is going to be a World Health Summit that is coming up, and maybe the hackathon can be coupled with that because it's a concrete opportunity. So you think now in terms of opportunities for your ideas, and you have 1.5 minutes starting from now. Maybe you see that ideas that are in one column would fit better in another column because of opportunities, or maybe you have same opportunity appearing in different columns. That's fine. No stress, you have 10 seconds, and the fate of Tulinia is in your hands. Okay, perfect. So now we are ready to go to the next phase. You have a ranking. I mean, that ranking is going to be useful, and probably we can discuss some of those things later on. But we want your most precious ideas and opportunities. So the ones that you have ranked first, now you have to, my goodness. So we are skipping some of the things that we were planned because of time. You have to use Padlet, not the Padlet that is available in the website of the forum, but you have that link. It's very easy. You have the QR code. If you scan it or you type the URL, which is simple because it's very short, you will get to a Padlet that has 3 columns. The 3 familiar columns that you have seen. So you take your most precious ideas and opportunities and put them in each of the columns. Each of you is only allowed to put 3, 1 per column, pairs of ideas and opportunities. So everybody going to paddle, everybody typing that. So again, you have a minute and a half. Actually, I mean, you can do it that faster. You have 1 minute. And it's important that you are putting those things in Padlet because we are going to use that for reporting. We have to report of the session. So whatever is there will stay. Whatever is not there will disappear like tears in the wind. Can I stop? Okay, time is up. You have a few more seconds while I type in this. .com. So magic is happening there. I hope you had the time to put your ideas. I'm giving you a few more seconds because I see some of you are frankly typing, so that's very good. And we want to capture your best ideas, and that's why we have this session organized this way, because we want the ideas of everybody to be in Padlet. Now, what is going to happen is the following. Each of you, let me see what we have captured here. Okay, that's good. Now we have like 6 or 7 ideas per column. So each of you have 2 votes per column, and you can place it in the ideas you think are best. Of course, I'm sure you will be thinking that your idea is best, but that's not the point. You cannot vote for your own idea. You have to, and it's very easy. You click here in this little guy, and you put either a heart or a thumb up, and we will be counting those to know which are the best ideas. So I want to start seeing a lot of hearts or thumbs up. Yeah, keep ranking. You still have a bit of time. See all you're very focused, but time is up. So now, what we are going to do. And you cannot see this. Let me move this there so you can see it. Hopefully. I'm sure I will break it, or maybe not. Good. So now we have a lot of, we have a ranking of ideas in each of the columns. Now it's when the discussion starts. I mean, we were meant to have a panel discussion, but the reason why it was organized this way is because, I mean, during the week, I've seen a lot of people that have been very vocal, and a lot of people that were very shy, and we were not getting their brains picked up. So I wanted all the brains to be picked up. Now you have to, we are going to go back to Padlet, and we are going to scan through some of the ideas that have received most votes. And I want you to get 3 hats. And I want the person that put that idea to explain in terms of science. So what do you think of that idea in terms of maximizing scientific output and knowledge, and that the potential of that idea? In terms of industry return, which if this idea that was put forward by that person has any potential for maximizing economic return, and what would be that? And I want also you to think in policy, because I mean there are like 3 sides of a triangle here. We have scientific output and knowledge, we have economic return, and we have socioeconomic benefit, which is the policy side. So we are going to be having a look at one of the ideas. I want the person that put that idea forward will explain from those point of views. And I want the rest of you to comment and say yes and or yes but.
Which column does saving lives come
I would say socioeconomic benefit. I mean, I will definitely think that that's very important for policy. So, okay. So let's go back to Padlet. I'm going to go back to Padlet. If I manage to get this done. Okay, that's not. No. Chrome. Okay, so because I cannot see that. Okay, so we have column 1, mouse. So 1, 3, 1, 3, 1, 1, nothing, 2, 1, nothing, 2, nothing, 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 1, 4, 4. Okay, I think we got a winner. Where is the winner? 4. Collection of. I'm sorry. Thank you. Yeah, that's better. Thank you very much. So, charismatic porcupine. I want charismatic porcupine to identify himself or herself, and you explain that idea from science return, economic return, and socioeconomic benefits return. And if you don't have a mic, we'll get you one mic. And I want the others to be thinking in those terms. So you can see good points of the idea, or maybe say some of the things that you see problematic in the idea. Please, charismatic.
Yes,
Floor is yours.
so it was an automatic nickname, first of all. So from the scientific perspective, from the scientific perspective is to, the idea is to avoid double efforts. So, and in the sense that maybe small, isolated experts, they do work in the same direction, but they tend to replicate methods or maybe to replicate efforts to go in the same direction. So the idea is to maximize this aspect, and also this also as a follow-up for what concerns the economic, because if we think about fundings, if we have many small projects, maybe focusing on a specific area, like it often happens, like with it's very interesting to have studies on single cities, of course, because you have more targeted outcomes. But for if we want to like leverage to linear what concerns EO and health, it's maybe nice to think of a more widespread development. And so if we have less small project but bigger ones, we also improve the economic effectiveness of the money. And the third one was policy, right? I have to think about that. I mean, in terms of policy, okay, this is very theoric, and I understand that. In terms of policy, if we can really collect the EO and health expert in a single place and motivate them to talk enough, what is happening here also. So the idea is to get the message to the policy that is as a stronger voice rather than having single voices trying to get to the policy level.
So now I want to see reactions. Mike is coming. If Mike doesn't come to you, you can come to the mic.
Okay, so good morning, everybody. I have a yes, but because I see a risk in having this as the very first section, that is the dispersion of information. There are too many experts and too much stuff to do. So we need to focus where we want our expert to work, and we need also to understand for what. So having the action as the preliminary point that needs stakeholders to be included as for the other high priority points in the list.
Thank you. There was another person who wanted to comment.
don't know if I very much like the idea, but I agree it should, well, you could narrow it, but you could also widen it, as in that you would want probably government representatives there, policymakers. But I like the idea because it creates buy-in. So if you involve stakeholders early on, there's more potential of it being successful.
Okay. Any other comment? Any other point? Will?
I find it rather disturbing that most of the comments there are about talking rather than doing.
And you are speaking from the policy point of view.
Well, I mean, most of the suggestions, including my own, I have to say,
Mhm.
most of the suggestions on there are establish talking shops, produce this, that, and the other, contact people, but it's not about actually what technically to do, how to develop ways of doing things, how to actually implement anything. It's all about getting people to know about it. And I find it slightly disturbing that we're all still at the stage of talking rather than, well, as I said, talking rather than doing.
Okay.
Can I reply? Can I hear again?
Yes.
The idea is exactly in this direction. So to understand what is the technical state of the art, and so yeah, oftentimes, so when we search for stakeholders, they don't really know what we can do. So, and they can have some difficulties also sometimes formulating what they can also possibly achieve from us as EO experts. So collecting, having a sort of cadastre of the expertise and okay, what's happening to Linea? What are also the peak experts? What is what are we doing? And also we saw from yesterday presentation that there is a rising number of very small companies in EO. So from this comes the idea as well, collectively, what is the know-how of the country?
Thank you. I see discussion started picking up. Can we go first to there and then industry perspective? I guess we are going to get.
Thank you. So I came to the mic this time. I think that one thing that is missing is, on one side, we have the experts. We also need the policymakers, because the policymakers are aware of international programs that tend to work towards policy and implementing what experts do. I missed the presentation yesterday, but 2 days ago, I briefly talked about an initiative called Présode for Preventing Zoonotic Diseases, which has work packages, programs, and international representation and experts and policymakers, politics, etc., etc. If we have the opportunity to actually bring some Earth observation experts more in contact with them, which is what we try to do at the agency level in France, then we can foster actual projects, future work programs, and overall help for policymakers. So I think this idea is going the right direction in terms of representation, but we also need to add policymakers to these discussions, I think.
Thank you.
Thank you. I've got a yes, but for William's critique and a yes and for the original idea. So the yes, but for William's critique, I think it's completely valid and absolutely applies. However, I think it would apply more if this idea were in the by 2028 column. Given that it's in the 2026 column, I think it's important to do an accurate and initial scoping so as not to produce outputs and charge ahead with practical implementations that, when presented to stakeholders, as I think was said initially, doesn't end up achieving buy-in, or especially if these tools are developed from within a European context and then exported to an African context. You don't want any feeling of imposition or these ideas sort of being thrust upon. So I think having a scoping phase that is more rooted in ideation than in practical implementation is good given the very short time frame. And then my yes and to the initial idea, which I really like, is maybe as an output, and maybe this would also help William's concerns, maybe as an output of that, that workshop, you could have a formation of a technical working group or something to that effect that would ensure that the ideation doesn't just become more talk and spawn more talk into 2028 and into 2031, but actually leads to rapid, tangible action. Thank you.
Okay, thank you very much. And yes, but I see that there is another intervention, but we have to leave it there. I mean, we have gathered all these inputs so we can examine them offline, and you can actually be discussing about your ideas. I mean, you were putting a lot of effort here, so you can discuss those ideas over a coffee. You have, let's say, I think 10 minutes for a coffee. So sure. Okay, so I just got the information that we got 5 more minutes. So there was a hand raise, right? So please.
No, it was just to follow up on the last comment. In the atmosphere, ESMWF, whenever they have a new operational system, it's never switched on straight away. It kind of runs in a kind of a ghost mode where it's evaluated in a kind of a pre-operational way for a period of time. And that's often quite useful if one wants to integrate new methods or new evaluations, that one at the beginning runs a system, should we say, in a kind of a ghost way, where when we look to one at the end of the season, say, well, how would things have gone had we used this? And that's a way of building up confidence in a new system without running too early with it. So it's kind of running in the background as a kind of a should we say, in tandem and in parallel. So just to kind of underline your point, and just to say that's operationally how it's done in the atmosphere, and that could perhaps be a paradigm for integrating more slowly new platforms into health policy and strategy in a way that builds up confidence, and then one can actually demonstrate its value in a pre-operational environment for a number of years before people build up confidence without having based actual real-time decisions on it and making investments in the meantime. So it was just a good point you made. I just wanted to underline it.
Thank you very much. Okay, we are going to leave that column. So now we are moving to the future, 2028, for the next few minutes. We have 7 minutes, so not much. Let me have a look. No, I trust you. I'm trusting Carolina. I'm trying to find it. I mean, this is the winner. Invisible Hornet, make you visible, please, and explain to us. Mike is coming to you.
We were actually working in groups, so it's both of us here. First of all, I just would like to emphasize that the HR department clearly overestimates our ability when they gave us the role of chief EO health architect. Anyway, well, the idea to us is that to be at the forefront, at least to bring Tolini at the forefront in this field, we think that having a young and brilliant person that can in the future bring in new ideas, new development would be probably one of the things that you need. And so the idea is let's put money on teaching. So with the idea of growing a new generation of scientists in this domain that could actually advance the technical advancement in this field. So in terms of industry return, probably all these students in the future will be able to start up new activities, and so probably by putting your money into grow up new brilliant students, then you will have a return in terms of what they can do in the future. So yeah, probably it's some idea that just I'm having while speaking is that probably you should also invest in incubators for startups and so on. And I don't know whether my colleague has other ideas on like industry return or policy. I'm not so.
Maybe just, maybe just to stress up the international word there, because as emerged also in these 2 days, networking is key, not only for the technological aspects, but really to close the gaps with the different national needs and the different stakeholders that we may have. So the international emphasis on that.
Okay, any reactions to that?
Thank you. First of all, I agree. I voted for that idea, so one of the votes is mine. I had also in my ideas, rather than an international PhD program, a master degree university course. So same idea, but one level below. And the reason is that you have more people, which in the end, maybe are not even going to work in the EO4Health sector. But, you know, if you have a PhD in that sector, you know, that's the expert. He is one person or a small group of person who are super expert in that. So you expect them to have this perspective. Well, if you have students which have a master degree in that, even if they go to consultancy, they go to do something completely different, but still they have this kind of formative path, this mentality. And so I think it's even a stronger idea to enforce this paradigm to be diffused in the society.
Okay, thank you. Last intervention of the session.
Yes, should work. Yeah. I totally agree with the idea, but I would move it forward. You would want to start that as early as possible. And I would like to see it interdisciplinary, because health comes from many different angles. So I think that would be one of the requirements, that you train the students and the experts that you need to tackle complex problems.
Thank you. So thank you all. I see that Tulinia is in good hands. Thank you very much. Great job. We have there, I mean, those ideas are not lost. They are there. We are going to track them, and we have the ranking, so it's very good. Some of the ideas like this one, I mean, maybe need to think backwards, because we are getting the most voted idea, but maybe the person had some idea that was a precondition for that. So we have to put them in temporal context. For instance, this idea of the masters and the educational program maybe needs a curriculum, so that curriculum will need to be a precondition for that to happen. So they have to be put into context. So thank you very much to all of you. I don't know if Loretta or Stefano or Caroline would like to say something.
Thank you. Thank you very much. Thank you, Jorge, for having led this very interactive session. So the takeaway from today's lectures and panelists is very clear. So we need to keep working on creating capacity, on sharing data, on training non-experts, because there are needs, and these needs have to be fulfilled by individuals and locals in all remote areas, and not only remote areas. So thank you again to all of you for your fruitful contributions, and we look forward to continue in this direction. Thank you.
Thank you. I have screenshotted, by the way, the 2031 winning note, which is mine. So I will just keep it on my personal board. I am a winner in one category. Thank you, everyone.
Congratulations.
Thank you. We have a break now. We have a coffee break of 15 minutes, so 20 minutes maximum. So we reconvene at 12:15. We are a bit delayed, but yeah, we will try to recover during the day. Enjoy your break.
Bye.
And sorry, all the speakers from the session that are still here, can you come up for a group picture, please, if you want to be in it?
I am a computer engineer working in the EO data exploitation platform since 15 years. I joined 8 years ago Starion to support ESA in the management of the EO platform related projects. And in this last session, we will explore we will have from the great speakers we collect an overview of all the actual of the state of the art of the platform that are sharing valuable data from the different agencies of interest for EO4Health, of course. I have the pleasure to share this sharing with Gilles Guyot, which is also the first speaker of the session. And he is a statistic professional with more than 25 years of experience at the interface of agriculture, climate, health, and environmental science with a view to multilateral policy action. He will talk us about the WOA digital platforms and possible synergies between Earth observation and the WOA data collection and data analytics activities that will be outlined. Please.
Thank you very much, Francesco. Good morning, everybody. Good afternoon, maybe for people online. So I'm a
upstairs. You should go
closer. Okay, thank you. Yeah, I'm a staff scientist at WOA. I'm the head of the data integration department, among other things, really data scientist. And I was asked today to present the various digital platforms that are designed and maintained by WOA. So it will be sort of a long catalog of different, really heterogeneous platforms. And I will try to outline also how Earth observation can be used for animal health. So WOA really has multiple web platforms, really heterogeneous. And I will jump immediately to the first one. It is WAHIS. It stands for World Animal Health Information System. It's really one of the cornerstones of WOA's activities. It is used for collecting data from our members, so states and regions, and not only collect, but also share those data with the public. Most of the data reported in this area, animal health diseases, is publicly shared relatively quickly. And so it's official data reported by the members. There's a focus on a little bit more than 100 listed diseases for domestic and wild animals. It is, I usually describe those data as raw data, but it's a little bit, actually a little bit better than raw data. It's actually verified, curated data. There is no data analytics coming on top of the data, but those data are really carefully verified with a lot of exchanges with country reporting, the members reporting those data. And most of them are publicly shared. Quite close to the WAHIS platform, there is something known as WAHIS Wild. It's currently in its beta version, and it collects information of non-listed diseases. So some diseases that are not considered really central of top significance for domestic and livestock animals. So there's a focus on wildlife species in this platform. The reporting is voluntary, and currently it's only in its beta version. Now, leaving the strict remit of WOHAS, we have the GLUES Plus platform. It stands for Global Early Warning System. It's operated jointly by WOHA, WHO, and FAO. So tripartite, as we say, tripartite platform. It's sharing internally confidential information, a mix of official and non-official data.
I'm not sharing a link right now because it's actually discontinued for funding reason, but there is ongoing well-advanced discussion for resuming the activity, totally rebranded platform with the same objective. And compared to WAIS, for instance, the advantage is it really mixes information from different, for the three organizations, and with an attempt also to triangulate the data from the three organizations. And they really focus on timeliness and early detection, and also some interest on what takes place at the human and animal interface. Now coming back to the strict WOA domain, we have the observatory dashboard. So the observatory, it's an initiative that started around 3 years ago. It has a focus, as you probably know, WOA has a mandate to develop norms and standards for international norms on animal diseases. And the focus on this platform is not on the diseases themselves, but how it's about the compliance with the norms of the different members and regions. So it provides a list of indicators that attempt to monitor and evaluate the implementation of our international standards. And it provides some kind of data-driven assessment to describe the situation. To describe the situation. So mostly descriptive statistics. There are 12 domains that are covered. For example, antimicrobial resistance, performance of veterinary services, One Health, movement controls, and so on. Descriptive statistics. In terms of data sharing, so we have access to the data reported by the members. The current agreement with the members that we are not allowed to share data disaggregated at the country or region level. So everything we publicly share is globally aggregated. Next platform is a performance of veterinary services platform that have been already described by Barbara, I think. So focus on capacity building and assessment of veterinary services, strengths and weaknesses. The goal is really to help countries to improve their veterinary infrastructure. We have also the Animuse platform, focus on antimicrobial use and worldwide. So global database providing information on and with the goal to reduce overuse and misuse of medication, and with the goal to curb antimicrobial resistance. It's of importance. Yeah, there is generally not any access to data regarding the exact use of antimicrobial. We have to use proxies and typically sales and import data rather than the actual use. There is also some particular agreement with different stakeholders about the level of data sharing that we give to the data, and this is set by each members. As you know, WOA has a mandate to set standards, and so it takes the form of really thick documents, the codes and the manuals for terrestrial and aquatic species. So for this platform, known as the SONT platform, is just some kind of user interface that facilitates access to the codes and manuals and to retrieve information in a more user-friendly way than just paper documents. We have also the Animal Echo. The Animal Echo is a platform that shares documents that takes the form of blogs and short articles in relation with animal disease. That focuses on animal health, but also animal welfare and One Health topics. And finally, we have the WOA e-learning platform, so a long catalog, a really very developed catalog of online training resources to strengthen veterinary services worldwide. We have various dashboards that were not listed explicitly in this short overview. Now, I have 3 minutes to go, I guess. So a few ideas about how Earth observation can be used for animal health monitoring and animal health policy making. So first, we can use health observation for to retrieve environmental variable and then build some environmental risk factors. So I'm really thinking about all factors, biotic and abiotic factors, and we can, for instance, track land use and land use change, vegetation, health, water bodies, habitat fragmentation, and so on. And those can be used to really build risk factors for animal diseases and particular zoonotic diseases. Very related to that, and then Earth observation can be used to retrieve climate variables. And so we could use climate services to anticipate potential diseases, events based on, for instance, what weather patterns. Typically, a mosquito population whose growth is related to humidity and water in the atmosphere, and this can be monitored and perhaps also anticipated with climate models. That really is the kind of thing that could be done and could be really helpful. We could also use Earth observation to support the WOHA incident monitoring system. So we have disease events taking place, and we become aware of disease events, and that's a raw information. There is a disease case somewhere or multiple disease cases in a specific region. Earth observation can help us to put these events into a context. So is it related to anything climate or environmental related? We can also use Earth observation for monitoring livestock systems. So in areas where the reporting system, the observation system are not very developed, and where there is a lot of grazing lands, for instance, we can imagine easily that Earth observation can help us to monitor livestock population sizes, for instance, and their location, density, and perhaps at a final level, the infrastructure of livestock farms. So it can really work as a data augmentation system for areas lacking strong reporting systems. Coming back to the observatory, it can also Earth observation can also help the observatory to obtain proxies. For instance, the observatory intend to monitor zoning and so animal movements, for instance. I think there's some information that can be retrieved or supplemented by Earth observation. Often we have data, and this data is not totally comprehensive or inaccurate or measured with error, and this could be advantageously supplemented with Earth observation data. And we could also think of anything related to improve disease modeling, so climate models and everything, meteorological models, short-time forecasting model, anything that can help us forecast with information that is not strictly related to animal or human population, but other biotic and abiotic factors. So in conclusion, there is a lot of room for interaction between Earth observation science and animal health science. We are just at the beginning of thinking about that. With Francesco, we discussed briefly before about, for instance, co-data sharing. Do we have API to share data in a consistent way? We are just at the beginning of this process. I think it's fair to say that probably in any of the platform that I've mentioned so far. There's no API, so all the retrieval is done through a manual user downloading process. We are spending a lot of energy currently on rigorous data policy, data sharing, data strategy to have processes in place. And of course, we'll be very soon in better position to talk with other stakeholders and define standards outside the organization. Thank you.
Thank you. Thank you very much, Gilles. We have 1 minute for question, if there is any question in the audience. We have one. Microphone is coming.
Sorry, this might be a bit technical as a question. I've just been looking at Wahis on my trusty tablet here. I'm of the age when I remember them coming in books and you just had to write them down. But can you actually export or at least download the georeferenced information on from this, or is it aggregated? I missed that.
I have to take a guess on this, and my guess is yes. I think there is geographic information. There's a lot of care, at least at the back office level, in terms of making use of consistent geographic information. So I would assume so. We generate maps very regularly, so everything has to be georeferenced. And that's a platform for which we share data most openly among all our platforms. So
okay, thank you.
Yeah.
Okay, so if there is no other quick question, I think we can pass the floor to the next speaker, Claudia Pitilio, which is online. Claudia, are you with us? Can you hear?
Yes. Hello, everyone. Can you hear me?
Yes.
Okay,
A
great.
bit distant, but I think it's
Okay.
Thank you. So Claudia Pitilio, we already know her from the other presentation of the other day, but she's a senior expert at FAO, specialized in disease ecology, risk forecasting, and GIS for animal health. With a PhD in geoinformation science and over 20 years of experience, she develops tools to forecast health threats at the human-animal environment interface. Claudia, please, the floor is yours. But we still are struggling to have you on the display.
Okay. So first of all, good afternoon, everyone, and thank you very much for inviting us and for giving us this opportunity to share our updates and information about the platform. So I'm trying to share my screen. Please.
Not yet.
Okay.
Just a few seconds. Okay.
Yeah. Can you see my screen now?
Yes. Thank you.
Good. Okay. Thank you very much. So we will. I'm also glad that. Since this presentation has been done closely and prepared closely with our colleagues, the IT colleagues, and I'm glad that Eduardo Machado is also here with us. So he has joined this this session, so he can provide more details on what we are presenting, which is an update on FAO actions for digital interoperability and data sharing. So, okay, so interoperability, it's a really essential, very important for FAO, because seamless data exchange across systems strengthen, of course, we all agree, decision-making, preparedness, and coordinated actions in food, health, security, agri-food system. Through integrated risk detection, evidence-based decision-making, rapid response and preparedness, and collaboration across all sectors and geographic regions, of course. In terms to this end, FAO has recently developed a platform which is called the FAO Risk Monitor platform. It has been launched recently in the beginning of July. It's a global public good to help preventing food crisis and mitigating the impact of simultaneous shocks, and integrates hazard indicators with predefined triggers for rapid actions and resource mobilization, covers both insurable risk like the droughts and floods, and non-insurable threats like the conflicts, for example, or locust. Here you can see some examples. And what you can see also here is that the risks that are included in this platform are diverse. There is drought, precipitation, floods, but also some risks that are not directly monitored by the FAO, like cyclones, earthquakes, volcanoes, and etc. And but this all impact the agri-food system. So that's why we are including them. And this is towards having a multi-hazard platform dashboard that allow us to better target and respond to these threats. And of course, in this case, it's also important for strategic investment. This, of course, can be done with all this information in mind, and what we call the data mantra, which I borrowed by my colleagues at IT, and so Carmort as well, that all this is possible if data are accessible, harmonized, documented, and unite. And so with this in mind, we are moving towards the development of this multi-hazard platform. But now moving to what we are doing on animal health threat in terms also of updates, because we were part of the discussion on the previous user forum. So, some information on our dashboard were already provided there. So in terms of updates, we have developed a framework for early warning of animal health threats. That takes in consideration and enhance the surveillance and early detection through the risk prioritization and monitoring and forecasting in order to have enhanced decision making during intervention, but also before, for forecasting these threats, and enhance also communication and information delivery. And these frameworks help countries that, will be released soon, as country to to improve their early warning system. So it's important at global and also national level in order to, first of all, enhance the data capture. And in terms of national level, you know that we have a number of tools developed at FAO. One of these is the MI, so the event mobile application for field data collection. So in order to capture surveillance data, and improvements have been done in terms of features and usability. A lot of work has been done in terms of interoperability at national level with tools that are able to enhance community-based surveillance and include this information in our system, the DHIS2 for public health, and also for laboratory data. So all this work actually has been possible through a multidisciplinary team work together with experts on the health threats, but also IT experts. At global level, and I hope that also, Eduardo is here, so we'll provide also more detail on that, if needed. There is an enhancement for generation of intelligence information. So first of all, Empress-I has been updated, improved, not only at global, but also national, to create national platform, and globally, the idea is to create an ecosystem of those tools, so to enable this interoperability at global level through the reference data service, and we will talk about this in a minute. All this is important to support our daily work, the FAO daily work on disease monitoring process, which goes from the detection of health threats to the verification, the analysis, the modeling and forecasting toward up to the dissemination and a response. And all these steps have dedicated tools at FAO and of course different steps of interoperability, integration with other systems outside of the FAO to enable disease intelligence for early warning and prevention. For detection, as we said, I mean, MI is very important. And also we are a key partner in the AIOS for more tracking. And verification is done through the FAO reference centers, the CLUS platform we will talk about a bit later, and has been touched also by our colleague in POA. Data analysis is done through the EMPRESI Plus, and this is a core platform for FAO. And then for risk assessment and forecasting, we have analysis done through other tools. And one of these core tools is the Rivali Fever Early Warning Decision Support Tool for this specific disease. But also we have developed the Avian Influenza Decision Support Tool, and we are now scaling up to other diseases. Dissemination is done through the real-time alerts, weekly updates, monthly updates, and so forth, up to the response. As you can see here. So moving to the EMPRESI Plus, so this is our core, as we said, to the Global Animal Disease Information System, which really enable the global animal health surveillance and intelligence, and provide information needed for the warning, risk assessment, as I said, coordinated response to animal disease that impact agri-food systems. And has been fully integrated, I mean, the AMI, this data collection at field level. And in terms of updates, in terms of interoperability, here we have, a lot of work has been done at global level to develop this reference data service based on the AgroVoc in order to have a standardized terminology on animal species, clinical signs, disease agents. Also at the global level, we have developed custom API with partners in order to let them consume data from EMPRESI, but the other end also to let us consume data from other partners. So we have two examples here. USA CDC, where avian influenza data are used by them. So there is this API dedicated for them to for the avian influenza information. And on the other end, we have another example through the Zero Tracker platform, which is an initiative. Well, this is a project together with WHO and the University of Calgary on MERS coronavirus, where this information from this Zero Tracker are now flowing to the EMPRESI. So it's a work ongoing, but those custom API have been developed. At national level, a lot of work has been done on the interoperability between FAO and digital animal health surveillance platform. So to enable, develop EMPRESI national, and also linkages with tools for community-based surveillance like the FIA data, or for public health surveillance data, as I said, like the HIS2 and laboratory data. Now, what next? What is the way forward? We would like to work on this risk mapping, on the risk mapping domain, in the fully integrated in the EMPRESI. You know that we do a lot of risk mapping and forecasting, which, well, on other dedicated tools, but they are not integrated yet. So this is a field that we will work soon, and also provided EMPRESI with spatial data layers in the national platform for use in intelligence. And here, of course, there is a lot of room for discussion with about Earth observation data and with you and within this forum. GLUES Plus is an important platform, as our colleague before said, is an initiative, joint initiative between WHO, FAO, and WOA, in order to have a better prevention through joint risk assessment. No? So the disease tracking system, and here there are also some updates in terms of integration between PRESI and the GLUES, but in the future, the integration with the other platform are planned. This is the iOS, so the epidemic intelligence from open source, with a key initiative from WHO. And for which FAO is a key partner in terms of contributing, but also user of this information in order to, I mean, it's leveraging on open source information, also fostering collaboration among experts to enable timely and effective responses. And it would be great to have this information also integrated in the systems, let's say. So at the moment is used in a manually way, but in the future we will look for the full integration of those systems in order to be more interoperable, let's say. Other tools, as I said, that are still independent, but will be integrated in the MPRESI in the near future, are the Ribali fever early warning decision support tool, and what has been scaled up based on that, the avian influenza decision support tool. So now for the Ribali fever DST, there are quite a lot of improvements. It was developed in 2019. At the moment, I mean, it's an early warning tool for enable the risk monitor, capacity building with the countries, and also issuing the alert. And we have developed a multi-criteria decision analysis script to incorporate expert input in the tool and enhance the interpretation of the data in order to understand if an alert needs to be issued or not, what are the specific areas, and I'm not working only, I mean, trying to, with this multi-hazard, as I said, integration. Other risk factors have been incorporated, and more important, we have now created a public version, so with information that are not confidential and will be released soon, while we maintain country-specific versions that are password protected to maintain and protect confidential information at country level. So a lot has been done. Capacity building is now implemented at national level in different countries. And for this reason, because it's been quite successful, we have developed also the avian influenza decision support tool.
Sorry, Claudia, I have to ask you one last minute, please.
Yes, I'm completing, and another important field is the data catalog in terms of open Earth observation. So to have an open and federated Earth observation processing and analytical platform, so an API that allows user to connect to Earth observation cloud backends in a simple and unified way. For this, FAO is developing an essential remote sensing data product portal in order to incorporate, I mean, to provide certified satellite observation data, but also to facilitate the data analysis. As this is a platform that will be available for internal use, but not only, also for external use and for doing analysis. And I think that since we are here, I mean, some ESA data have been already ingested, but here there is room, of course, of this, and also all this, let's say, discussion on particular on the MPRESI and this data, the satellite, the Earth observation data is a follow-up of what we had in Rome a year ago on the interoperability workshop. So I can conclude here. Thank you so much for your attention, and maybe Eduardo, if you want to add something or questions that we may proceed. Thank you.
So nothing
Thank
to
you,
add
Claudia.
on my side. Thank you, Claudia. Thanks a lot. I mean, I think you covered everything, but I will be here in case there is any follow-up or any questions.
Thank you.
Okay, so I think we at the moment don't have much time to use for question or comment, but we will have the final panel discussion where interesting question and discussion can come out. So please, Claudia, stay with us for the last session. And now I would like to invite Luigi Possenti on the stage. Luigi is the head of the ICT department at Istituto Zooprofilattico Teramo, where he managed Italy's National Veterinary Information System and animal databases on behalf of the Ministry of the Health. With over 20 years of experience, he has designed major systems for animal identification, health, and food safety, including the National Database for Cattle and the Electronic Veterinary Prescription. So, please, the floor is yours.
Thank you, Francesco, for presentation, and it's good morning to everybody, and it's a great opportunity to explain and to show you the Italian National Veterinary Information System that we develop among about 25 years for Ministry of Health, that is a competent authority for veterinarians in Italy. And okay. Oh, okay. No, okay.
The left one.
What is?
This one.
Okay, thank you. Okay. All information, the national information system is a lot of different web application of information that are all included in one unique web portal that is the central access for all the users. We have about more than 300,000 users in Italy, starting from breeders, but also official vets of private vet, and all of these has their specific role into the system and their specific functionalities. And sorry, okay. So sorry. Okay. And all the system is based on EU regulation, and especially in the last year, animal health law summarized all the previous regulation, and there is the principal reference for information system that we develop. And the single, in this portal, the information system, the core of the information system is the animal identification and registration and traceability system. And all the other system that we develop in these years are based and share the data with the system. So we have a collection of different applications that register and collect data on animal identification and registration, on animal health, welfare, and on veterinary prescription and pharmacosurveillance, and also for food safety official controls. All these systems are included in the same environment and share data with the interoperability system or sharing data, and then we have the other system that collect information catching them from different kind of system, combine them and prepare the output also to provide data for WOA, EFSA, and so on. And then we have a data analysis platform that collect all information from all the system and then provides to the users, the competent authorities, decision makers, and so on, dashboards and advanced data analysis. But okay, the animal identification, registration, and traceability system is the core, and in which are registered in real time all information regarding the livestock, including movements, including slaughtering, and every event that occurs to the animals. Then we have other system that manage and then support the veterinarians in field activity controls on animal health, animal welfare, control on identification and registration system application, or in food safety. And this application that can collect the data are also the operational tools for the users and help the users with technology to register and to make this activity on the field. So they can collect the data, but also help the vets in this case, and this is a win-win experience because the users the users use this system because he had an aid in this activity, and the system collect a lot of data and correct data. So okay, we have animal health information systems that is connected with the labs to receive all information regarding the serological test on animals and so on. And this is Seaman, that is an application for the management of outbreaks, and also in domestic, but also in wild animals, and provides a lot of services for the users, for vets, and especially for online management of epidemiological investigation. And there is, for example, a tool that we call I don't know if, okay, it's a short video that show how it's possible to have a graph of all the contacts between the breeding farm, starting from the outbreaks and this graph is based on the traceability system, the animal identification and registration system. So we have all the movements, and analyzing this graph that is possible to export in Excel or to print, and then from the graph is possible also to reach other information registered into the different information system. This is an help for the official vets during the epidemiological investigation. So and this graph is for trace back, trace forward. So is in trace back is possible to identify probably the source of the disease, of the outbreak, and in trace forward is important to understand the spread of the disease, and is very important tool for them, and to define the intervention plan to control the disease. And then the same system also provides export to provides export files for WAIS and for European ADSN. And it's possible, at this moment, he provides some files to upload in this system, but is ready for a full interoperability in real time, in automatic way, to exchange data, to provide data. Then, okay, there is another system that we have, is the pharmacosurveillance system and the traceability all veterinary medicine. We have digitalized all the process from the prescription, with electronic prescription, to the treatment on animals. And we have providing also some tools for vets that have to register the prescription using mobile phones and other web application, and is mandatory in Italy, the electronic prescription. So we collect, we have about 5 years of data. We collect all information regarding the use of veterinary drugs in Italy, and we are now analyzing data for antimicrobial resistance on appropriate use of medicine. And then we have also GIS system that collect data and give the possibility to have a map representation of the disease, and in which case we use also data from heart observation to define some prediction model. And I don't know if Anna Maria showed something about this in the previous days, but this amount of data that we collect with different information system then are analyzed, and with a lot of dashboards with different purpose. So we have some indicators for to verify the quality of data inside the system. And so we have some dashboard indicators and also analysis procedure that provides to different users some anomalies or bad quality of data. But also we have online dashboards, and this is open data regarding the livestock, information regarding livestock, the livestock distribution, and the graph that show how during the time the different livestock information change. And so these some quality indicators regarding pharmacosurveillance and a prescription. We have also some dashboard for antimicrobial resistant and appropriate use of dashboard. And at the end, few words about dashboard of animal health that combine information from animal identification and registration system and from animal health applications, in which are collected information regarding the field activity of veterinarians and then laboratory results, and combining this, we develop different from different information system. We develop different data source for statistic indicators, and so we prepare this dashboard with tables and some indicators using data that came from different information systems, and providing and creating new value on the data, and that are very useful for decision maker, competent authorities to identify the different kind of phenomena, and then to planning action plan against the spread of disease, or in some cases also to define the surveillance plan, in according with the result of this data. Okay. Yes. Yes, I'm close. This is some different dashboards, and okay. Data collection and data provisioning for us is two sides of the same coin, no? Because from one side, there is operational tool that with technology help all the users to collect data, but they help in their activity and in the same time collect data. And then the result is a large amount of data on which is possible to define dashboard analytics, and this is the return also for the users, because all data are analyzed and provided with for their interest, and so okay, thank you.
Thank you very much for your all the impressive information that you provide. Unfortunately, we are a bit late, so again, we don't have time for question now, but I hope there will be time later on in the panel discussion. Thank you again, Luigi.
Thank you.
So it seems I will be the next speaker. All right, I'll try to be as fast as possible. My presentation start with a question to everyone. I'm not asking you to take pen and paper and write, but I guess the answer will be different from anyone. But the question is, what is a digital platform? And I'm sure everyone will give a different definition of it. So I would start from our definition of a digital platform, and why it is important, the most important building block of all the actual important initiatives that there are in the in our section in ESA. So of course, an EO Earth observation data exploitation platforms, to be defined like this, must have EO data accessible, but also the possibility to process the data where they are. This is the most important paradigm that ESA is following since 10 years now. And to achieve this result, also the platform need to provide the possibility for scientists and users to upload and run their own algorithm on the platforms, instead of downloading the data locally and work in a sort of silos. If the scientists, the users can use integrated development environment to directly develop science on the platform. And also, hopefully, any platform should provide also space and tools for the training of the people. And recently, also, I would say we can add to this definition also the possibility to have some AI-related processing hosted by the platform. Is very important right now. A quick example of the digital platform as we intend, is the ESA Charter Mapper, which is the place where the Charter International Space Disaster presented yesterday by my colleague Philippe is where actually the work happens. So you can find there a map, a geo browser, and different tools that any scientist overall the world can work together to create information rapidly and maps for the intervention in response to major disasters. But it is not the only platform around, and so there are many of them developed by ESA contracts and that now have become also self-sustainable. And an effort that ESA made to group all of them inside the same container, let's say, or the same, starting from the same portal, it's called the Network of Resources. The Network of Resources, in a nutshell, offers a portal where user can browse and search for services provided at the platform, looking for the data they need, and also, but not least, they can ask a sponsorship to ESA, from ESA to start using these capabilities on cloud and at no cost. And this has had a big success in the last 6 years. And there has been sponsored almost 2,000 projects using the network of resources. And this is yet another building block of what I'm going to present now in terms of solution of digital platform in ESA right now. This is just a snapshot of the current providers that are on the in the network of resources, but more and more will get onboarded every month or so. In the meantime, in ESA, it has been followed the principle to create more and more an open science environment. Open science means open science, which include, of course, the openness of data, accessible source code produced by other people in the same community, accessibility of binary code, so the possibility to execute at any moment this code to reproduce experiments, the possibility to share results with the rest of the community, the possibility to make them reproducible, and also to learn from other works, so in sort of a training and closed feedback for this. And the way what is driving this revolution in ESA is the open principle of the FAIR, which, as you can read, it means that any experiment or science produced in following these principles must be findable, accessible, interoperable, and reusable. I will use this word also later in the presentation to show how the actual initiatives are following these principles. One big initiative that is following this principle and is supporting the open science at the moment is the Earth Code project. Earth Code projects, among the other things, provides a permanent place where science can be stored, the result of of science, including data, code, documentation, what we call an experiment, which is the execution of a specific algorithm with specific parameters. And this can be shared, can be maintained also after the life cycle of the project. I will skip this because I think we are short in time, but so the first challenge of Earth Code is to maintain the results of the project after their lifetime. So data, code, documentation are available on the Earth Code catalog, Earth Code repository, Earth Code website. And from there, they are maintained beyond the project lifetime. So is Earth Code fair? Yes, because data, code, and documentation are kept in catalog and repository. Also, a digital object identifier is provided. Code is on GitLab at the moment, GitHub, and documentation has widely open access. And how much is fair you can see from this slide, because for any of the component of the FAIR principle, there are specific, I don't want to go too much in detail for technical, in the technical details, but for any of the principle, there is a specific component in Earth code that can be used to achieve the fairness of the science. But there is another challenge when you open this possibility. Is the cost of the producing new science, new experiments, and this is done using the platform that are inside the network of resources. So it returns, and it is also sponsored by the network of resources. And this allows user to discover an experiment, to understand what it does, and try to reproduce the same results or new experiments, changing a bit the parameters. And another very important initiative that is supporting the open science in ESA is APEX. APEX is the next step after the experimentation, which allows any algorithm or piece of code or workflow around that produce good results to become a service. A service is a reachable endpoint 24/7 for anyone in the world that want to access to an already deployed version of the algorithm, change parameter, run it, and again, to reach that level of maturity, Apex support the developers in the refactoring of the code, in the making it scalable and also accessible using the most used standards interfaces, and also standard way to create catalogs of data. And again, this is all done following the FAIR principles. Another way to enhance the interoperability and try to talk the same language with the other platform, beautiful platform that, for example, I saw today, is trying to use the same, ISA create a sort of blueprint for the creation of digital platform. I don't know how much time I have left, but because I think okay. Anyway, this is the EO4Health, the building block that are used as a blueprint to create a digital platform right now. And this includes building block for the creation of a processing capability, catalog capability, federated identity capability, and so on and so on. So in the case of a partner, an external entity company that want to replicate the work we are doing in NISA, this could be the best place where to start, and having an idea on how to have the same results, speaking the same language, using the same standards, and enhancing more and more the interoperability between different systems and especially different environment. This is my last slide. I will just, I would keep it for the final panel, but just to anticipate, there is a path using this building block that I just shown you that need to be followed to have interoperability from and toward ESA systems and Earth observation data, and this could include also the takeover of these systems, the network of resources, Earth Code, Apex, and EO4Health, and maybe in detail they must be explored with more time available, and this could be probably during the last panel or whenever you want to reach me out to have this. And thank you for your attention. So next speaker is Felipe Brandao, that is working has been working to create the together with his team and his consortium, including also Brockman Consulting, the creation of a platform for EO4Health resilience. And for this project, I am also the agile Scrum Master, and I'm very happy to have you here today. Please.
Thank you for the kind words, Francesco. I would start by thanking WOA and ISA for hosting and organizing this event. This will be a joint presentation, as Francesco has already mentioned, myself from GMV and my colleague Gunnar from Brockman, but this is the result of an effort of a lot of people. You have some of the names here in this first slide. The main idea for our presentation is to provide you with a quick snapshot of what we have done from a platform perspective. DPSTL is something that already existed, but that we have leveraged and hopefully also contributed to the implementation of some things that maybe were missing. But in any case, the main idea is for you to have a better understanding of what we have done from this perspective. Very quickly, in this project, and to provide you a quick overview for those who do not know the EO4Health Resilience Project, this is an ESA initiative in which we have tried to merge these two worlds, science and technology. This is very much one of the key topics that we have been discussing for the past almost 4 days. So, in this specific context, on the technology part, it was us, GMV, Gematics, that are also here with us, and Brockman Consult, meaning the experts on Earth observation, on digital platforms, and in the science part, IZS, PML, both also here with us, that have also presented some of the activities that you will also see during my presentation. And we were also fortunate enough to have expert advisory. We have Willy Wint with us today. Always good to have you as a backup. But we also had Professor Simone Calderara, Professor Marco Marchetti as expert advisors, and also obviously ISA as key actor as funding agency. The goal for the project was quite obvious, was try to advance public health decision making using Earth observation data, or at least contribute to this purpose. The main topics that we have worked in terms of services development and implementation were vector-borne diseases and waterborne diseases. On the vector-borne diseases, we counted with the inputs from IZS and waterborne diseases from PML. All the work that has been put in the development or adapting some of the services that we have afterwards implemented in DPSTL have been done with the overview of these two institutions, IZS and PML, and having this, what was called virtual observatory, an online platform providing services outputs together with other health-related products and analytics as the backbone of the project, basically serving as interface with the audience and with the users that would be interested in checking the services and products that we have generated. Very quick overview of these services. This has already been presented by Ana Maria. Yesterday, the West Nile virus service is focused on the circulation probability in the Mediterranean basin, meaning we have scaled up the model that has been originally developed to Italy, to the entire Mediterranean basin, and also an important part of Europe. Using the same input variables, obviously, but we had to change and adapt the model that originally did not run directly in DPSTL. We have a time series in the platform since January 2022, updated every 16 days. This is a bottleneck in terms of temporal resolution of one of the input variables, NDVI, which hopefully in the future can be covered with the ESA data, the future missions. So hopefully this temporal resolution can be improved in the future. This is a very short video that I have prepared just in case, because this is a large data set and can take some time to load, but this is for you to have an idea of this service within DPSTL, running through the various timestamps that we have there available since the beginning of 2022. In terms of waterborne diseases, we have again leveraged services that had been developed in other ESA activities, and what we have done was like specialize them and integrating them in the virtual observatory. You have here, for examples, environmental Vibrio cholera risk maps for Vembanad Lake, environmental E. coli concentrations for the same location, flood maps for Vembanad Lake, and also non-cholera Vibrio infections in the Baltic Sea region. And for the next stage of the presentation, I'm about to do something that it's always a little bit tricky, trying to make a live presentation of the platform. Hopefully, Murphy is asleep and will allow me to do it without any roadblock. Sorry, that let me just navigate EO4. Ooh. EO4 dot is a dot int, hopefully. Sorry. So this is probably the most obvious entry point to the platform, the EO4Health website from ESA. And if you navigate through this website, you will reach this EO4Health virtual observatory. It allows you to discover a little bit more about the observatory, providing some overview of basic functions of the platform, and also, in the end, you can check the list of layers that we have there available for anyone to access, those that are public, and also the layers that are private due to different reasons. If you click on the link, I accept and continue. This is the main interface. I will start by, and I see that, by logging myself in to ensure that I can show you all the layers that are there available. We start with the West Nile virus circulation probability model, but if you check here, you can see a vast list of layers grouped by thematic areas. Waterborne, the layers that we have developed for Madagascar that have been presented by Lorenzo in the first session today, land surface temperature, a series of layers. And you have seen already the West Nile virus. Let me just show you some other layers that we have here available. For instance, NDVI for Bologna. Carla from IZS has presented why this is important in their session on Tuesday. If you click on the sidebar, you can have access to the description of what we are seeing in terms of layer. Some of them even have direct links to other web pages that provide additional information on the product that you are seeing. And EVI is a quite widespread EO-based product that can be used for health purposes, as explained before. If you click on this star, you can have a quick snapshot of what is the main goal of the project. And if you navigate through, we can do this for NDVI, but also we can check NDWI, also presented during this forum. We can change between base maps, and here, for instance, it makes much sense to use satellite data, world imagery, to see this data, because if we zoom in, we can confirm if these surface water bodies are in fact well classified. You have some visualization tools that allow you to interact with the data that is there available. It's challenging to navigate looking at that TV so far away. We can also go, for instance, for the waterborne diseases products. These are cholera risk maps for Vembanad Lake. These are two private data sets that are private because we were asked to put them as private by PML to avoid any type of social alarm. Time is short, I have to speed up also to give the floor to Gunnar. You have, for instance, an NDVI layer for Vembanad Lake, and this I remembered yesterday when Shuba was presenting the dangers associated to floating vegetation, to microorganisms present in the water. So this is in Vembanad Lake, and you can see very clearly floating vegetation, and this could be also a good tool to help for health purposes. I would now switch back to the presentation to allow Gunnar to present the remaining part. This was a movie that I had in case of any emergency, but fortunately all went good. Thank you.
Thanks, Felipe, and also Francesco for the kind introduction into the platforms. My name is Gunnar Brandt from Brockman Consult. I think I have 3 or 4 minutes left. So what comes now is a bit the background of digital platforms. I decided to draw a nice sketch, or what I think is nice. So in the middle there you see this ESDL, deep ESDL, the data cube you may see, which is a platform for supporting research in earth science. And it has been funded by ESA for several years, and now we are at an operational stage. And in that case, we leverage these services to implement the EO4Health project that Felipe just has shown. But it's also used by many other projects. It's now integrated into Earth Code, and you just learned what Earth Code is. That spares me some time. So basically, the research done in ESDA can be published and submitted to Earth Code in the end to the permanent catalog and the repository of data, so that others can reuse and reproduce the data. There's an interoperability error. We heard about this also from FAO. There are other platforms, and we heard about OpenEO and others that may want to interoperate with DBSTL, and we adhere to common standards, of course. You heard about the network of resources on the left. So the network of resources is the mechanism that may purchase services from DBSTL, and that's ESA's mechanism to support projects and research. And with the sponsorship, you see at the bottom the viewer that you've just seen in action, or at least small parts of it, which is then used to implement project work or services work. And you've seen that is branded and tailored. So that's a DPSTL service. And you see there are project 2, 3, and 4. So there are others, other research projects that leverage these DPSTL services. So for us, or for this, for the inside view from a digital platform, this is a very good environment to reach sustainability, which is always the ultimate problem if you have projects building up platforms and services. That we are now just past the final review and continue as a sustainable platform within these ecosystem. Yeah, what offers the platform, just very briefly, it's a modular offer. You can have, of course, data access, scalable processing with CPU and GPU. We have this Jupyter Hub as the standard IDE, and you have collaborative team functionalities that you can share your code and data and resources, tooling for machine learning and AI, and in the end, dissemination visualization. You've seen the viewer or the virtual observatory, and also the dissemination option to Earth Code is key for many projects. No further details here. I think we are out of time, right? I know I have 1 minute left. Yeah, you see these screenshots on the top right. That's the typical Jupyter Hub. So you log in as your team. You can develop your research, and once you're happy, you can you can, or we support the publication to Earth code, which means that either your Jupyter Notebook is directly pushed, or we build an EO application package, which is an OGC standard, and this is then registered to the Open Science Catalog, and that's the last screenshot there in the middle. And then anyone can find your research and your data with a description and a reference, and can simply find it and re-execute it from there, which means that you will be basically linked back to the platform where you can then rerun through the Jupyter Notebook, or simply rerun the application package and get your output. I think with this, I'm happy to close. You find these links there. So if you're interested, just go to the links. There's documentation, a website, and you can, of course, contact us at any time. Main interoperability standards stack as the catalog API, WMTS for providing image data and time series data, and API coverages for data itself. I think I stop here. Thank you very much.
Thank you. Thank you very much, Gunnar and Felipe, for your presentation.
For running through the presentation.
I would like to invite the last speaker, to Cédric Marsboum, is CTO of Avia GIS and leads its research and development department with 10 years of experience as an environmental engineer specialized in remote sensing, spatial modeling, and machine learning for vector-borne diseases. His research covers dengue, arbovirus, invasion dynamics, and biodiversity impacts on disease. He coordinates VectorNet3, collaborates with the Spatial Epidemiology Lab at Université Libre de Bruxelles, and leads works packages in EU project on emerging infectious diseases, including E4 warning, becoming, MobVec, and Restore ED. Please, the floor is yours.
Thank you. So I will present the Mood platform, which is a platform that we developed in Horizon 2020 project that just finished beginning of this year. So the aim of the platform was to make an independent online platform to support both research and decision makers, which in our case would be public health and animal health. We were a project on epidemic intelligence and surveillance. So the aim of the platform was to provide operational tools that we developed in the project to the wider audience. What made this platform a bit different from research platforms we had in the past is that we, in parallel, also decided to form an international non-for-profit that could sustain the platform after the project. As the platform was specifically aimed towards the users, we decided to build the platform with a co-creation process. So right from the start, we had the end users of public health agencies, animal health agencies, researchers, data scientists, etc. Part of iterative process to help develop mainly the interface, the tools, etc., which was actually quite interesting, especially to people like Willy and I. What they would ask, what we would find very normal, that you can just find it on the internet, and apparently other people did not. So actually it was a really nice process. So I will not give a live demo in the interest of time, but if you want to access a platform, that's the link. And I will go over this a little bit quicker, but basically what you expect to be able to do with a platform like this, you can do it. You know, we have seen all the platforms present today. It's a, you know, you can access all the different covariates, you can query, you can access everything, you can download everything. We link also with disease data where possible. So we link with WISE. Paolo, who could unfortunately not be here from WOA, actually was very instrumental in helping us with this. We also link with tools for event-based surveillance, such as PaddyWeb, which is built into the platform. Things like that. So just to highlight a couple of things, so you can do comparisons. You can also build time series or extract time series. In this case, for example, LST. So we provide normal satellite imagery, but also derivative of that, like fast Fourier transforms from these time series, which is what you would need to build then models afterwards, and for which you cannot use just the raw data. We also, just to highlight, because Willy's here and he's very proud of this. This is, for example, one of the things that is on the platform, where it's a cumulative temperature maps for ticks, where you can then see tick activity change throughout the year based on temperature, obviously. As we were really focusing on epidemiology, it was also important for institutes and researchers to be able to upload their own data and extract data from that, because there's a lot of sensitivity with health data. So this is we decided in such a way that you can upload your points or polygons and extract all the data you need to run models or run tools without the data actually becoming part of the platform. So it stays in your own system, so it complies with the necessary security compliances, and so you can upload the points, extract the data from temperature or whatever layer you need. Here we, for example, extract data from different model outputs that are in the platform for H5N1 or NX for wild birds and domestic birds, for example, which was one of the models that are in the platform. The same as we provide, of course, all the metadata. We link with tools that were existing further developed in the platform, such as PaddyWeb, which is a tool to extract event-based surveillance based on text mining and scraping. So we link with the tools that you can use the data together with all the necessary covariates that are also in the platform, together with the codes for models that we also provide with the platform. So within the project, we developed a lot of models. We usually just publish the scripts on GitHub or with a paper, etc. But here, so we also link them together in the platform, so it's a one-stop shop for everything you would need to run models in epidemiologic intelligence. Just to briefly highlight, because we're running a bit out of time, what we consider the unique part of the project. Well, I have still a minute and a half. Perfect. So this is what we see as real, what is different from us from platforms we developed in the past, right? So the mood association is completely independent. So we have 7 founding institutes. So CIRAD from France, FEM from Italy, the ULB and Avia from Belgium, INRAE also from France, Mundialis from Germany with Marcus, who you probably all know, and an Ergo from Willy. And so it's really to keep it completely independent, so also to link with other research projects, keep everything open access, and make it as a single access point, because that's one of the things that really came out of the co-creation is, yes, all satellite images is, for example, available on the ESA platform. ER5 is available via CDS, but for a lot of public health institutes, that's already overwhelming. Here we we provide a single access point to everything they would need to run the models that were developed for, in most cases, early warning. We have a flexible disease data import, both what we provide and user-owned data sets. And then we try to keep it as user-friendly for the audience as possible, or target groups as possible. But, you know. All right. That was it.
Thank you very much, Sadiq, for the presentation. You have been quite in time, so if there is any question in the audience for him, there is some seconds to answer to it. We have a question. If you can wait, we can provide you with the mic because for everyone. Thanks. No, it's.
Thanks a lot for the presentation. You put sustainability in the beginning and said the project just ended. And sustainability in financial terms is always the big challenge for all of these platforms that have been built within projects. So do you have a sustainable business model that you may disclose, or?
So yes, so that's what we're currently trying to do with the foundation. So with the foundation, we're looking for funding from other research projects, for example. So we are participating as with the foundation in other research projects, but we're also talking to more institutional institutions in Europe to help support the platform, independent from only research funding.
There is a question from the public online, and this is a question for all speakers. Do you have data on how many people are using these platforms? Do you collect any data through surveys on what kind of people are using, etc., like health ministries, academia, etc.? This is for all speakers, this question. But since you are here.
Yeah. So yes, we did. It was also because we had to report this, of course, towards the commission when we were developing this. But so yes, we did. So I don't know by heart because I don't work on the platform day to day. But we do track usage. We did 2 surveys in the past on who is using the platform for which reasons, etc.
All right, thank you. And I would say if there is no other question, we can close the section. Yeah, I'm very glad that I've co-chaired with this session with the very interesting findings, and I discovered I learned a lot today regarding all the platforms that are around outside my usual scope and my usual point of view. So thank you very much, everyone, for the attention and for the presentation. So if I'm not wrong now, we are free to go for lunch, and then we will reconvene for the final panel discussion. Correct me if I'm wrong. I am. Let's hear from them, for the organizers.
So we are proposing to continue with the concluding session, and then we can like close the forum, and then we can go for lunch. Yeah. Sorry? Like there is no break now for lunch. We will continue with the closing session, and then you can go for lunch afterwards. We are just waiting for one ISA colleagues to join us for this session. Stefano? Okay. Yeah. So, colleagues, we will start the concluding panels with the summary from all the chairs of the sessions. So we invite the chairs to stay here. And you, it's fine, yeah. So Francisco will cover. And the other colleagues to come up to the stage. Even from day 1, day 2, day 3. Yes, please. So we will do a wrap-up, a summary of the whole user forum.
Yeah, I'm just getting the rank.
So we need to end the slideshow. Stop sharing. I don't know. Those are very high. So no more presentation. No. So I have somebody. Oh yeah. So you can put it here.
So thanks a lot to everyone for staying here with us for the closing. I have the pleasure to introduce Inge Jonkere. She is head of the Green Solutions Division. So all the Earth observation for society applications that you have seen over the week, in particularly the ones tailored to health, fit in the division which is chaired by Inge. She has also long-standing experience at United Nations FAO, and I have the pleasure now to hand over to Inge, and then we will have a presentation of one slide from each chair summarizing the key recommendations, and then a final discussion all together. Thank you. To you, Inge.
Very much. Good afternoon, everybody. Sorry to just jump in your meeting. I was in an ESA board meeting, but very pleased to be here. Big congrats to the organization of this meeting. I think it's very timely and also very important. So as said, indeed, I work in the Green Solutions division, and I have a few slides to present here. So for people who are not familiar with the ESA scheme, there's something new actually also, and this is in this slide. So it's called the Integrated Policy Expert Scheme. So as you know, and as Stefano was saying, we work EO4Society, but ESA, as you know, is a very technical agency, and we really want to bridge much more with the policies. So the scheme allows for anybody working outside, let's say, the ESA or the technical side, really to integrate the work with ESA. So the idea is that you come on the premises. The time, I think we said between 3 months and a year, and you keep your salary from your institutions, but it's like a secondment in which then we top up for all the practical and logistics. So actually this started last year, and I have to say it's quite successful because we already have a few people on the premises, and we also want to expand this in a later stage also to academia, further with the Science Hub, but then also with companies. So if people are interested, please, I think the email is here. We can talk to me or to Stefano. We were really pleased to have really much more that integration. Next slide. So then we have EO Africa. ESA, of course, the main core business is Europe, as you know, and even if it says European Space Agency, but also Africa is a very big part of the work we do, specifically because member states and some member states really want to invest a lot in Africa. So it's the network for research, innovation, communities and applications. So some of you might have heard of that Africa Summit. We were just discussing actually this week when we will repeat it. So most likely we're going to do it next year. And then there's also a bit in the framework of these IPES, we also have African Research Fellows, and there's always an open call. And so we do have now 4 African Research Fellows also in Esrin. So which activities we have? Mainly research and innovation. So the idea is that we do have a knowledge transfer with them. We do face-to-face trainings online. There's the MOOC, so also African-led, because as you know, the Global South is really getting much more importance, also leaving these knowledge transfers to them. So this is really what we try to do. So in the R&D, we do have also the demonstrator projects, the explorer projects, and then the tandem with R&D. So here you can see a picture of some of these fellows with us in Esrin, and it's for really ad hoc research for zones where they really want to work. And then I think the last slide was on the SUP. Thank you. Yeah, the Sentinel users preparation. So basically, this is also a call which we have open. I think you can click a bit more. There's stuff on it, or the different themes to show how we can really integrate it. Yeah, so there it goes. So it's an activity in collaboration with the European Commission. I'm sure you also have talked already about the link with the Commission because we do work a lot with them. And so the SUP is really to see a preparatory phase of all the Copernicus expansion. And it's a very strong support by ERSC and also the member states. So why do we do this? We also want to help the Commission from the practical and technical point of view with new Copernicus expansion datasets and then also future operational working phases. So the objective is to have really the buildup of this expertise and to ensure also the readiness for the uptake, because it's nice to have all these satellites, but they have to be used. And this is also something done in the SUP with an open call. As you know, ESA has a ministerial in November. So the SUP will start from that onwards. And then finally, well, there's a lot of assets with the call of proposals. People are always interested in money and in statistics. So these are the statistics. So after the evaluation, these are the 19 highest marked proposals, and they're all covered all these expansion missions. So you can see that there's interest for all the expansion missions to be researched at, and then all high priority applications. So there will be a separate ITT to cover this application field of mining and extractives. And as you can see here, it's under evaluation. So there's different teams and different specific topics where I work on. I think it's too small to read, but I'm sure you will get the presentation. So these are the contracts that have been signed and kicked off end of 2024. The same, I won't gonna read it. And then the CEF, I hope you have heard of it. If not, please get in touch. So it's called the Stakeholder Engagement Facility. So ESA is extremely strong in having companies and a long history with companies who have been involved. But what we really want to do also is to expand and go to the non-EU space sector. So really to have new players, let's say, in this whole framework of Earth observation, because there's so many applications that people are really not aware of that it could be of use for them. So this is the idea of that CEF. So it's called Stakeholder Expansion Facility, meaning that in a way you could see it as looking for new users of existing and to become existing solutions. So how can we do this? Basically going to really end user meetings, but then also outreach activities, ad hoc actions to really show impact of results of projects. The scheme is also to identify the key actors for all the various policies, because as you know, a lot of people working in policy are very far from the technical field and vice versa. And hence the whole idea of that IPES. And so the idea is really to bring this all together. Of course, if you start this, there's a huge way out there. The world is huge. So we focused on a few themes, which you can see at the right-hand side. So food, ecosystem, carbon, energy, and sustainable development goals, just to have a few and to start from this. But the CEF will also have a follow-up. And so we also will go to other themes. And I think this is the last slide. So thank you very much. And now I hand over to the chair again.
Please, Tanya, now the floor is yours.
So first, thank you so much for coming to WOHA. We are really very grateful for making the time and coming to our concluding sessions. So now you will hear from all the chairs of the previous sessions, summarizing what have been discussed, the topics, and then the recommendations and the way forward. So we'll start with day one, and maybe me and Stefano, we have the first panel we had on One Health. I don't know if you can read it because it's very small. But what we discussed there, it's that the One Health approach is very important. It should be an imperative. It's not an afterthought because it's the way to connect the sectors, especially human, animal, and the environment, and to ensure that we more work together towards prevention of health threats, not just always preparing to respond to them, because this is the most sustainable pathway to take, is to prevent them. And then we talked about how important Earth observation and artificial intelligence tools to help us achieve this goal. And we highlighted in the panel some of the UN and intergovernmental organization resolutions or declarations that can help us to galvanize the support of member countries. And we talked also about the importance of networking, like this network that we are here now. And there is also an example here about space and global health network. It's mainly public health, so we are hoping that it will turn into One Health, and they can include also animal health in there. And finally, there's a need to make those Earth observation tools more accessible, more understandable to non-technical people, so they can feel comfortable using them in their field. And the way forward, we talked about how to foster more this cross-sectoral collaboration and to strengthen data sharing and data integration and governance. And of course, the aim for all of us is to translate this data into action. Otherwise, it will stay just principles and nice concepts. But to have real impact in the field, we have to translate it into projects and activities. So I don't know if you would like to add, Stefano, from day one.
Thank you, Chadia. So moving forward, we have had then a dialogue talking about Earth observation industry at European level, but also with the health authorities at European level. So in the dialogue, we had ESA, we had Gordon Campbell dialoguing with Nova Space, which is running a study for ESA on the impact of Earth observation. So it was really focused on the impact of what we are doing and how can we leverage this impact in the health sector more and more, both with institutional stakeholders, national ministries of health, but also private sector. So health-oriented companies, as well as research institutes that are working with AI. So LLMs, large language models, was a topic of discussion to support better accessibility, in particular, and integration of Earth observation solutions. Another aspect was that the Copernicus datasets are expanding. We have seen also in the slide on the SUP, we are going to double the mission of Copernicus. So there is also a need to communicate the benefits of all these new satellites and new sensors for health applications. And the last aspect, which was very much underlined in the dialogue, was the usability aspect. We will touch upon this also in the concluding session on the digital platforms that was just concluded a few minutes ago. But this is a point where ESA is particularly active and is really working together with the partners. So it's a federation of initiatives that can lead us to success. This was followed by the health resilience panel. So the focus here was on resilience. It was a panel that included WOA in terms of biorisks, and as well as the WHO Pandemic Hub in Berlin, plus three, I would say, very high-level scientists. One is sitting here next to me. So I will mention just a couple of points, and then I will hand over also to Willy for a wrap-up on this health resilience panel. The two main points have come out of this panel. So one was, how can Earth observation help to track droughts, floods, and habitats and animal movement that can determine health threats and health risks? So there is also a security and the resilience component there, which is very strong. The second point was that Earth observation can support early detection for certain diseases. We have seen some examples. For example, Ebola was mentioned, but also other vector-borne diseases were mentioned. So how can we tailor activities, research activities with academia, but also how can we leverage a citizen science, and how can we engage with policymakers in helping them in the building of their very advanced data intelligence systems. We have seen the WHO is putting strong effort with the Pandemic Hub in Berlin on this. So how can we be part of all these very impactful initiatives which are global, providing Earth observation intelligence for resilience and security? Maybe, Willy, you want to add something on the panel conclusions?
Yeah, I guess I do. I think it's important to remember that we're sitting in this room, we're technicians mostly, or policymakers, or strategic decisions, and we sort of understand this field. But as the information becomes more familiar and actually more relevant as health issues become more serious, then the word spreads. I mean, if we'd had this conversation 3 or 4 years ago, people would have most of us would have looked vaguely at Sentinel and said, what the hell's that? The word's getting out. Now, the fact that the word's getting out means that more different levels of people are getting to the information. So we mustn't forget that we have to provide the information in at least 3 different ways, because you've got to tailor your information to the audience you're hoping to affect. There's no point being super technical if you're talking to people in the pub. It doesn't work. So I think we've made huge advances over the past 2 or 3 years
3 or 4 years even in terms of access to the data. There's still a long way to go because it's, as is one of my bugbears, it's actually not that easy to get it at standardized, even Sentinel stuff if you're looking at long-term or large extent information. But we've got a long way to go. We have to translate, we have to find advocates, I think. And I mean, I've learned an awful lot in the last 3 or 4 days, and particularly actually in the last 10 minutes about what ESA does, and it's hugely impressive. But it still hasn't. We've got a long way to go to reach the different levels of people, because if we want people to trust the information, and if we want politicians in particular to trust the information to either extend the funding or enact decisions based on this information, then they have to A, understand it so that they can defend their decisions, and B, believe in the results, because what we're asking them to do may not be that convenient or comfortable, and it may be very expensive. So I think we've made huge advances over the past few years, but I'm afraid to think, as with any developing technology, there's a long way to go.
Thank you, Willy. Then I think, Chadia, we can move to day 2, so Tuesday morning, please.
Thank you. I think it's me. It's my session. I had the pleasure to share with Gordon Campbell this session, where we had 5 speakers from the international organization, such as WOA, FAO, but also from DG Sante, DG ERA, and EFSA. And I think it was quite interesting to hear from these speakers, because we moved from, let's say, some project in the field to the policy and to the funding that DG ERA is providing now to implement some program in Europe, knowing that this vector-borne issues is growing thematic, up to the presentation from EFSA, where she talked about the importance, let's say, of sharing intersectoral collaboration and interoperability. We discussed the importance of having ground data to validate what we see with Earth observation, and there are some nice project that WOA is running in North Africa that could inform the global let's say community about that. Yes, we discussed of course the policy that is including this data, Earth observation, climate variable in the legislation. And about interoperability, just one consideration that I wanted to do during these days, because I heard a lot about these words, integration and interoperability. I think that it's important sometimes to, before arriving to interoperability, to know what to do with the data we are going to integrate. Because sometimes we discuss about, let's integrate, but what for? And what we as institute, we are engaging in this kind of activity with some countries, with the Ministry of Health in particular. So we have already some difficulties to integrate data within Ministry of Health. And maybe this is a forum like this one would help to keep the dialogue about the objectives. What we do, risk assessment, risk communication, early warning, surveillance. Sometimes organization doesn't know what kind of data they collect that they are going to integrate. So this is what my last consideration about that. Thank you.
So we have now, you will do it, Stefano? Okay.
Thank you, Chadia. Yeah, unfortunately, the two chairs of this session, both the ESA representative and the WHO Berlin, are not in the room. So I think I will try to summarize the recommendations that came out of this. So the session focused mainly on the open innovation activities that ESA has initiated during the pandemic or right after the pandemic for health. In this context, Sarah, which is sitting next to me, presented all the very rapid prototyping activities, such as, for example, RACE, and also the data platform that we built together with NASA and JAXA to monitor indicators of the effects of the lockdown and therefore the economic consequences of the pandemic. We have also looked into other aspects during the session. For example, the projects that we have run with partners. These projects, some of them have been run also in informal settings, so not only with the traditional cycle of funding activities, because we needed to be very quick. One example was the response to the Bergamo city. So Bergamo was actually the major impacted city in Europe by the COVID. We have seen from Ilaria, our colleague from ESA headquarters, the dramatic consequences of that. And so ESA signed a memorandum of understanding at the time to support the Bergamo and the Lombardy region. So we started a very rapid activity on the green areas and how to facilitate outdoor activities for the people that were in the lockdown. By categorizing the green areas, private and public, also to identify the air quality in the city, around the city, and how to recommend to the citizens what would be the best places and time to actually recover or leave the extended lockdown period. We have seen after this the digital twins that have been kicked off within ESA. There was a very good example with Portugal and Denmark, where both the green spaces have been coupled with also heat waves and other environmental effects, including pollution, that could be harmful also before or during a pandemic or a large epidemic event. And then we had a very nice presentation by the Space and Global Health Network, which is linked to the United Nations Office for Outer Space, the UNOSA, where basically a very large task force of policymakers and scientists are building a curriculum on space and global health, including all the major space agencies, to provide disease tracking, climate health risks, disaster impact, capacity building. So this was, I would say, quite widely addressed. With this, we concluded the second day. We had a wrap up with some recommendations that will be included in the final report. And then we moved to the following day. So let's now move to day 3. Do we have anybody from day 3 in the room? Shuba? Please, Shuba, if you can join us on the floor. That was for the afternoon.
Yes, another one. It's okay. Okay, thank you. So is it okay to speak from here? But ours was after.
For the people online, it would be nice if you can come on stage. Meanwhile, Shuba is joining us. Let me just give a brief overview of the morning of day 3, which was on non-communicable diseases related in particular with the WHO Institute for Cancer and the European Society of Cardiology. We discussed the environmental factors which may lead to cardiovascular events and cancer development. And we had a number of use cases using Earth observation data that demonstrates the great added value of this in the epidemiological analysis of these events. So this was I would say, a quite comprehensive discussion. We also had a contribution, oral contribution from CNES delegate, as well as the DLR representative provided also an overview. So it was not just by ESA, but I would say also 2 major member states of ESA also presented their activities and views on the non-communicable diseases aspects. And now, please, Shubha, I hand over to you for the water-related part. Thank you.
Thank you very much. So we had a session on waterborne diseases yesterday afternoon. We had a number of presentations on various aspects related to different diseases associated with water. And we discussed the dynamics of the pathogens responsible for the disease. And we also talked about disasters associated with water, floods, droughts, harmful algal blooms. And the presentations and the discussions range from the science that underlie the investigations and predictions of waterborne diseases, and the presentations and the presentations were, there were presentations from different organizations on how they deal with waterborne diseases or disasters associated with water. The presentations were followed by a panel discussion and a discussion from the floor, where we dealt with the priorities for the next 5 years. And the responses included the importance of improving our understanding of the underlying science. And that includes ecology, the microbiology, the genetics of aquatic pathogens. We talked about the need for understanding better the pathways of pathogen in the environment to humans, and the role that socioeconomics, infrastructure, development pressures, engineering infrastructure, all those things would play on how the pathway operates in different localities and different regions. And the progress towards the next improvement would include societal engagement so that they become part of the solution, and capacity building. We spent a lot of time discussing the importance of having easy access to satellite data and the need for more in situ data, and also for the obvious importance of being able to integrate these type of environmental data with health and disease data. That's my summary. Thank you very much.
Thank you very much, Shubha. And now we move to day 4. This is our last day, and we started with the discussion on capacity building. So we have with us Sarah. She was the facilitator for the session, and she will summarize for us what was the topics there.
Yes, and one of the things that we did to summarize this session was to divide between current state challenges and the future needs and opportunities. Current state, there were many notions that overlapped with all the other days, previous days. So the current state is the fact that monitoring and early warning systems could be enhanced by EO and AI together. It was discussed about the importance of digital platforms and to make them user-friendly. And regarding challenges, one main notion that started today's discussion was the fact that industry is more interested in invest on things that are profitable, so curing diseases, and not on monitoring to prevent diseases. This was a very interesting concept, and I think it was the first time that it was mentioned throughout the week. But regarding challenges that once again overlap always, and they come always into discussion, is the fact that there's the need of interoperability and there is the need of covering data gaps. There's an issue with resolution. Sometimes we have high resolution on ground truth data on diseases, and we have data sets that covered and have much coarser resolution. And regarding opportunities and future needs that can cover these challenges, one of them is storytelling. Not only to make people understand the power of monitoring, but ensuring that this can pass into the policy making and decision making. As for the technical part, there is the importance of enhancing forecasting. And this means improving our models, improving data sets, but also making sure that both the health community can make use of Earth observation and vice versa. We also had this exercise, a capacity building exercise that Jorge can be, maybe you can tell the outcomes of this.
Thank you, Sarah. So it was me together with Loretta and Caroline and Sarah. Thanks for all the help. And I think a big thank you is going to you because you were actually doing the work. So what happened there is basically everybody had a chance to contribute. For me, that was very important to hear people that we were not able to hear before, because I mean, this is the context that we were working on. And to have a discussion where everybody could or had to step out of their comfort zone and had to take the role of scientist, industry, and policymaker. I think that was also very interesting because it put you in different contexts and made you think in different ways. If you look at the Padlet, and the Padlet is there and you can access it, the more we are moving into the future, so you see column 1, which a very small scroll bar, column 2, the scroll bar is bigger, and column 3, the scroll bar is even bigger. That means that there are less and less ideas as we are going into the future. And we have a lot of ideas for what is happening in the immediate future. The feeling, if you are looking at those ideas, is that there is a lot of foundational work that needs to be done. There is the need to involve more decision makers, and there is work to be done on awareness raising, on space-based essential health variables, on taxonomies. All that work still needs to be done, and I don't think we have yet come to a conclusion on how to do it. When we are moving forward to the next stage by 2028, there is a pattern that is emerging that is, okay, we are moving into policy, into the policy action area. It's setting up funding lines. It's mentioned quite several times. Start international programs on EO4Health, masters or PhDs, and starting setting up collections and interoperability. I mean, we have been discussing about interoperability a lot, but that doesn't seem to be now. It came out in the discussion in that roadmap on the second column, which is medium term. And when we are moving to long term, the things that are mentioned are dedicated research centers, citizen science collection, and there was a very good point, if you are looking at the Padlet, that it was mentioned citizen science collection, anonymized. So we are all very much aware of the constraints that we have to face. And it's clear that from the AO domain, we can get the data. From the health domain, there are some constraints there. And I was surprised to see a portal in the last column. And we had a session, the last session was on portals. And I'm wondering, and this is not to answer or to discuss, is to all those colleagues that are working on portals, maybe thinking to the future, is there a way to harmonize somewhere that there is maybe different backbones, but the portal is the same so users don't get confused? And even further, is there a need for a portal I mean, I'm getting messages from my insurance company that it's going to rain, so I put my car in the garage because maybe there are I don't know, hail coming into the car. I'm not looking into a portal looking for, maybe there is more direct ways to connect to some users, and especially if we are talking, and in the UN we are very much concerned about emerging countries. If we are talking about those countries, portals, really? So just food for thought for the future. I'm not looking for answers. Thank you.
Thank you. So now to the last session that we had, it was about digital platforms, and we have Francisco from ESA to give us the summary.
Yes, so in the last session we just had very quickly, we explored all the existing solution in terms of digital platforms. We tried to have a common understanding of what we define as digital platforms. We saw so many different versions of platforms, data shared, and I'm surprised that all of these agencies and platform are very keen to start having a dialogue about interoperability, and even if not always possible due to regulations that are that make this not a very easy exercise, but we tried to go more in the technical details of the discussion instead of maintaining the political aspect. And as ISA, I hope I have passed the message that ISA wants to support this evolution in providing tools like Apex, Earth Code, and EO Epica and network of resources to create, to establish bridges between the different system, and also some guidance and possibility to host data and processing capabilities from the other very beautiful platform and environment that we saw today.
Thank you, Francisco. So this concludes the summary. I don't know if you have any immediate feedback to us that you would like to share.
Yes, I always have opinions. So if I have the floor, I'm happy to share. No, first of all, big congrats, because I really think this is a very important meeting. Of course, health is very important. And although in the global political context we live in and the meeting I just come from, the only thing that matters now is security, civil protection, but you could also take health as a part of it. So if we have to be resilient, also the human health is part of it. So I think this is very important. Now, the other reason why I really think this is so crucial, and a big thanks to Stefan and the whole team to do that, is to really bridge the gap with the policies, because I really see, and I think everybody here in the room knows, we speak different languages. A policymaker speaks another language than a technical person, and it's very hard to bridge that gap, because it's always who's going to do the first pass and how we're going to bridge this. So I think these meetings are crucial to integrate. And this is also a bit the first slide I showed. I think ESA is very aware of this, and we want to change how things went in the past, like having top-notch, cutting-edge solutions with them maybe cannot be adopted. So it's all about the uptake also. So this is why, and as you know, and this is also why I say it's so timely. For people who don't know, ESA works with Ministerial Council, in which money is pledged for a 3-year cycle. So this is happening in November. So we're working now on this proposal. So having the back and also the background of this meeting, we can really take it up and put it in there and really link it to what's needed from the society. So in that part, as it's written now and as we see it, is to really start doing co-design. And this is exactly what I hear in here. So it's not by building up a very cutting edge solution and then see who can use it. So we do other way around. So really taking the users on board from the start and then go first. And this is really very nicely explained now. And then also talking about platforms or solutions, also there, it's not ESA who's going to decide if we need a platform, but if users want this, maybe we will have both solutions. We have a mobile application, but also the platform. So I think this is the new paradigm we're working with. And I think for this kind of meeting is crucial, and it shows also the will for ESA and other agencies to really work together on this. So for that, really congrats and thanks for inviting me here.
Thank you very much. Any other feedback before we close the session?
Maybe just a word also from my side. I really would like to thank all the agencies. We had more than 10 agencies here working on One Health, so really spanning from environmental health, animal health, food systems, and human health. So this has been, I would say, extremely enriching also for us as Earth observation community. Is the very big takeaway. Please, let's continue this dialogue. This is just the first step, so it has to be continuous dialogue. We will try to do our best to repeat a user forum as soon as we can, but we need to continue the dialogue virtually, even when we are not in person. The second big takeaway is that the Earth observation industry is developing very fast. So all these, we have seen many AI solutions, we have seen many now even HPC-based digital twins and so on. So there is also a technology revolution, so we all need to keep up with that. They provide solutions, but they also need investment in capacity building. And we have touched upon that today, in this morning. I have to thank a lot also Caroline Perrin from the Geneva Digital Health Hub, because this is really a landmark example of what can be done in Europe, not just in Switzerland, for bridging the gap, which is what Inge just mentioned, between all these new technologies, very fast developing technologies that are arriving, and the needs of the users that sometimes are institutional users and they don't move that fast. So this gap can be addressed very well. I also want to thank Loretta a lot, my colleague from ESA, Loretta Latronico, because she gave us also an interesting angle, which is artificial intelligence ethics. Of course, we are here talking about medical data, personal data, health data. What are the consequences of these very advanced AI systems? And this to be paired with open innovation. So on the other end, we have large corporations working with startups. We had 2 examples here of innovative ideas that stood up. They won the hackathon. They've been supported by ESA for a couple of years in the acceleration packages. And now they are working together with larger EO companies to operationalize these ideas into services. So this is, I would say, a bit the wrap-up that I wanted to have on our side. And I open the floor here for discussion with everyone, including also the facilitators and the chairs that have been supporting in a fantastic manner the user forum for these days. Thanks.
Yeah, thank you very much. I really appreciated the overall summaries because they were so dense that we started mixing everything. I'd like to come back on the session that we shared with Shuba on water. I think water is the most important thing we have in the universe. And we saw that the flood was the biggest impactor on detrimental health and so on. And I'd like to make a recommendation to ESA that there should be some effort done on floods. So we had some time ago the capability to unite the hydrologists and the oceanographers in the coastal zone where they meet. And more people live in the coastal zone. And the coastal zone is the place which is extremely impacted by storm surge and flood. So let's say it's called like compound events. When you have a storm, you have problems coming from the sea to the land and problems coming from the land to the sea, including river plumes and all the debris and so on. And I think this is important. Then we had a contract called EO at Sea, which is now finished. And we just launched a contract called EO4Floods. But the EO4Floods needs the follow-on of EO at Sea. So again, The people working in the coastal zone, they do land to sea, sea to land, exactly what we do in the CEOS Coast Virtual Constellation. And I think ESA should continue the follow-on of hydrocoastal and the follow-on of EO at sea to support and provide the right data, especially for the forecast, which is what EO4Flood is doing now, is developing a like 1, 2, 3 day forecast of floods. And one more pitch, we had a very nice session on capacity building this morning. And I'd just like to remind you that coming from COSPAR, I would like to advertise that we are absolutely ready to co-organize capacity building in the Global South. And we have a method to do that, and we talked earlier, and ready to collaborate with many institutions, many agencies together, like the one we're doing in Cameroon in hydrology with ESA, with NASA, CNES, UMEDSAT, and COSPAR. And I think this is the way to do it, because it's, again, putting all the agencies together, going in the same direction, pushing in the right direction. Thank you.
Give the mic to Gemma, please.
Thank you. I just want to support that request, but I would like to take it a little bit further, not just to focus on floods, but also the health impacts of floods. So not maybe only mapping of floods or maybe destruction of infrastructure, but also impact on humans. So what does it mean for their physical health, and what does it mean for their mental health?
With EO4Floods, we're not talking about extent. We're talking about predicting the flood and the level, because we saw the level is the problem. Whatever the extent, when the water rises above the infrastructure and the sewer water goes into the rivers, and then it's pumped again. And so with the altimeter, we look at the level, and also the mix of altimeter and optical data. We predict river discharge, which is the proxy for, tipping point, and then inundation. Then the insurance after the battle, they would like to know which houses were destroyed by the flood. But this is really after. We're trying to be before that and make a forecast, which is not easy. You can see all the flooding events with the dramatic consequences that we had in the past, just in the past year. And so that's a difficult job. But it's really about the level. Huh? Yeah. In terms of health, then it's your job.
Yeah.
Okay.
And I would add also the impact on animal health, because we always forget what happened to the animals during floods and heat waves and droughts and all those disasters. Thank you. Would you like to add something, Shuba, about the water issues?
Yes, thank you. You're absolutely right. I come from that same mentality, shall we say, where we have this point of view where everything revolves around water. But I would like to, again, floods are not the only problem. We need to maintain water quality during floods, before floods, after floods. So a critical point from the health perspective is we have to maintain water quality, decrease and eliminate ideally the pollution that we bring to the ocean, to the coast, to the lakes. And pollution can take many forms, and that our interests should take in the problems from pathogens, from chemical pollution, from plastic pollution, anything that harms the water quality. That would be what I would like to add. Just because you gave me the floor, and before I give it up, may I just thank you and Stefano and all the organizers for this wonderful job. Thank you very much. And I hope that this will continue. It's just a beginning and that we will continue to build bridges and do things together. Thank you.
Anybody else from the floor? Yeah. Could you pass the mic, please?
So I have two hats. I have a hat for the health program in CNES, but I also have a hat of a disaster risk manager. Broadly speaking, it's the translation. And I can't help myself but make a quick comment about what you were talking about, the aftermath of a disaster, health quality, sanitation, etc., etc. We mentioned SEOS a second ago with the COST virtual constellation, but we also have a working group on disasters where we have a CNES-led observatory called the Recovery Observatory, which is a perfect fit, for example, for water sanitation or water quality after the to observe the aftermath of a disaster and the impact on local population, for infrastructure, for health, etc., etc. We've already produced a couple of products for specifically the aftermath of floods and the water quality in refugee camps and also in the disaster struck areas in Libya. And I invite you to look at the page. And it's a nice little space and nice little observatory where there's a lot of capabilities, and we're in the stage of scaling it up to a more sustainable way where it would be working by itself and by its own. That's just a little advertisement for CNES and SEOS.
No, thank you. You brought also important issue about the impact on vulnerable populations, like in a humanitarian setting, conflict or war. And then on top of this, you have disasters and this cascading effects and compounding disaster. We have to address those needs too. Thank you.
Absolutely.
Marcello? Sorry, you need the mic. Yeah.
It's a marathon.
Sorry for this long walk. First of all, I would like to say that I'm here representing ERSC, the European Association of Remote Sensing Companies, which has been, which is working closely with ESA in understanding new thematic areas of interest for the user community and for the industry. And from our point of view, the industrial sector in the application domain is getting more and more interested because we have seen in this forum and the previous one organized in Frascati that there is a big demand in terms of value to be created from Earth observation technologies and derived services. So we are going to get more and more involved. I've seen also in this forum that there is an increasing interest in responding to ITTs from the European Commission, from ESA, from the national authorities. So from our side, I would expect that we will have a more proactive role, not just following the developments, but having understood, like in this workshop, the directions that the scientific communities and the national authorities and international bodies are taking. We are becoming more able to try to anticipate certain developments and get in line with the user requirements. So we welcome very much this type of events, and we look forward to the next one organized by ESA and the other partners. Thank you. It's my turn to walk.
Thank you, Marcello. Just to save time, I sit here and comment directly. Just a quick reflection. We have been discussing a lot about trying to use Earth observation data in an operational setup for the health domain. I think maybe there is room to leverage good examples and success stories like the Copernicus Emergency Management Services and Security Services, where and I know this because GMV is involved in both components, maybe there is room to make like a spin-off and leverage some natural disasters. Obviously, no one wants them, but we have been talking a lot about this disaster management and what consequences can come from that. And if we are talking about health, maybe it's a good leverage point to try to develop something in the health domain, because we are already working on it, and maybe there is room to further explore these two components.
Yeah, thank you. Shoba, and maybe also Carolina and our colleagues, if you would like to add something. Shoba first.
Thank you. I just wanted to make the point that more than once during this meeting, the point came up that we should make sure that the data and the beyond data, the methods, the predictions, that they reach where it is most needed. And that means the global south. And I wondered if there's a possibility for ESA and all the other agencies involved here to put in place mechanisms to include more of the global south. I can imagine that there are routes through CEOs or through bilateral agreements with space agencies from the south that are very much absent here. Anyway, it's a plea for that. Thank you very much.
Yeah, maybe if I just can comment on this. So I completely agree what you say. I think, unfortunately, very often the data is more needed where it's less available. But for this, so first of all, so we have that EO4Africa. ESA signed this year the MOU with the African Space Agency because there's a new one in place. So this is a very new big collaboration. And then thirdly, what I also see, and unfortunately, I think the FAO person is not here anymore, to make better use of agencies and institutions who have that impact there. So for example, the FAO, which I come from, so this is why I know it so well, they do have offices in all of these countries, and they have local people and local engagement. And I saw in your slides about the uptake, because it's not about creating a great solution, it's also about people having endorsed it. And so with the use and the collaboration with these kind of agencies, we can make a difference. I don't think ESA can just go into all these countries and do some capacity building and go back. Sometimes we do it, but the impact, unfortunately, is not always so big because you need to reach the people who have the say. And so if we can get to the local communities working with agencies who have an impact locally, we could do much more. And so through also the work of Stefano and the whole team there, we really do see the difference. And by jointly organizing, going from capacity to knowledge transfer, we also have better impact there. So this is something we're really looking at, and we take all your points. And then to come back to Jerome also, water is very important, but indeed we focus on all the disasters.
Thank you. I think a lot of things have been said already, but I can only agree that, you know, capacity building is really about empowerment, but it's also multidimensional. So we need to strengthen skills, systems, and partnerships. We also need to collaborate across different levels and different regions. And that's why platforms like the ESA User Forum are so important, or the Space and Global Health Network that really give us the space to come together, to collaborate, to exchange, and to build the foundations of this emerging domain. Because I originally come from digital health, which is a little bit similar. You put two domains together, and it took quite some time to really get to these foundational steps of building taxonomies, building capacity for different kind of stakeholders, for policymakers, but also for implementers. So I think this is a really good development, but we still have quite a bit of work to do. We have done the first steps, and I just want to repeat my call of action to the audience to reach out to us, the Space and Global Health Network, come together, contribute, and help building and structuring this domain.
If I may add something concerning the non-conventional players, we have seen today a successful story from an NGO who has used our ESA platform to improve their agroforestry activities in the north of Madagascar. So I think we should really continue in this direction, because the non-conventional players, they can really bring a model of collaboration, co-creation that could really reach the users, the locals, and people that are also living in remote areas. Thank you.
Thank you very much. I see also our FAO colleagues online. Claudia.
Hi.
Hi.
Thank you. Thank you very much. And again, I would like to thank you all for this opportunity to participate. And it's very unfortunate that I could not come to be in person. But I want to highlight the importance, as also strengthen the presentation that I gave in session 1 and 9. The importance of the multi-hazard monitoring as a foundation of resilient agri-food systems, and livelihoods. Because, I mean, this really reflects the One Health approach, that everything is interconnected. So, and for this, FAO has developed this risk monitoring platform that acknowledge that every risk, biological, environmental, climatic, or socioeconomic, has a direct or indirect impact on agri-food systems, on livelihoods, and on health of humans, animals, the ecosystems. So it's very important to reach this, not remaining in silos, let's say, in the different domains in this way, but to try to interconnect at the level of those digital platforms with reflecting also framework, of course, and in this case we have the One Health. For doing this, of course, we need granularity, so detailed data at global, national, local level. We need interoperability. And for this, it's important also to take into consideration what is important at global level and what is important at national level. For example, we maintain national platforms to serve our stakeholders, and an example is the Ribali Fever Early Warning Decision Support Tool, which is implemented at national level and used by the veterinary services. And we have been there in July in another training and workshop, for example, in Tanzania, and it was really amazing seeing those veterinarians or epidemiologists that they not have experience or familiarity with Earth observation data, with GIS, but because there is a tool that facilitates this analysis, they are able to speed up to do this risk assessment, analyze data, and etc. So capacity building is very important. I would like to emphasize what also has been said before and highlighted by Inge. And those tools should be, of course, developed with having this in mind. So thank you so much again.
Thank you very much, Claudia. I saw also Willie and then Jorge.
Yeah. Yes, thank you. We heard on day 2 that one of the most important applications of the sort of knowledge we have is early on in an epidemic or early on in the spread of a disease. And Moritz Kramer in particular has been involved in a number of incidences of this. And his recommendations his thoughts were, remember that try to use simple data. Don't get too complicated. And there's a number of examples, particularly in his work in COVID with the UK, that using the right proxies and the right indicators allowed him, or that his team, to provide the UK government with advice as to where the disease was spreading and what was likely to happen very quickly and with relatively little data. And the little data is obviously an issue with diseases. And another part of that particular presentation from Moritz is looking to the future now and beginning to make his outlook or his approach much more interdisciplinary. I mean, using funny things like physicists. And in the longer term, new techniques, foundation models, AI and so on that can essentially fill in where there isn't any data. So we're at a stage now where techniques can begin to fill the gaps that we have seen for so many years. And the other thing that occurred to me on that particular perspective was that one's got to be prepared to react anywhere. It's not just, oh, I've got a model for Germany, and there's something that happens in Myanmar, and we think, well, my model for Germany doesn't really work. Oh, now what do I do? So we have to start thinking about upscaling and extrapolating, well, not extrapolating, but upscaling all these tools that, for example, ESA is so good at producing. It's not enough just to say we know what we've got a proof of concept that works in Luxembourg. If that proof of concept is worth doing, then it's got to be upscaled and expanded so that it can be applied in all the possible places where it might be applicable. Then whose responsibility is it to do that? I mean, if someone came to me as a small SME and said, right, upscale that model to make something global, I don't have the resources, nor do I have the resources necessarily to spend trying to find the funding to do that. I'm too busy trying to find funding for something else. So there is an aspect of this is a public good. It's not just a commercial operation. And that's one issue I do have with ESA's approach, is this need for making it financially sustainable for uptake. I think there is an equally strong case for saying this is something that is a public good. It is to an extent the responsibility of the authorities to help upscale these things, having funded their start, yes, but to, in particularly important cases, to enable them to be used in a much wider perspective, rather than relying on economic forces, because there are many other economic forces going on that tend to put these at a rather low priority.
Just to comment on this, I think there's a misconception because that's not at all the whole idea of ESA. We do have the commercial part, which is one flow, but that's for the industrial competitiveness, but we have equally the whole part for the public goods. So of course, again, the mandate of ESA stops on the prototyping and making of it, but then the uptake, of course, that's beyond also what member states ask us to do. So that's why we have to partner up, and this is why these meetings are so important. And then the economical value is not at all the main partner. As also you were saying with these platforms, now we have even a whole structure set up in which all the project results are openly available. And of course, it's paid by public money, so it's public available. And so it's not the economical driver after this. Yeah.
Yeah, I wasn't saying you didn't do it. I'm just saying you should do more of it.
Thank you. We have a comment behind you. Yes.
Thank you. Thank you. Well, I collected in the meantime several points. Is it on? Yeah. So the one is importance of platforms. I may agree that we don't need ever more platforms, but I think data availability and interoperability are key here, because we still face this issue that data is not available when you need it most. And the good example, because we are situated in Germany, you may argue a relatively well-developed country, but when there was this harmful algae bloom in the River Oder a couple of years ago, there was nothing, and we did this on our own behalf because we just wanted to know what happened. So we partnered with some institutions with in situ data. They even went out with boats on their own behalf, and we just looked into the EO data, but there was no service, no monitoring, nothing, and there still is not. That's why if you make data openly available, freely available, that helps the global south as much as everyone else, and even in Germany. So that's the basic start. And platforms, for me, have at least this purpose. So if you adhere, and ESA makes a good job in really enforcing this, it was a hard journey for us as well. But now we are reaching this level where we are interoperable and have common standards. Then you can see that you can either build a startup upon that, or have a simpler access to data if you need it, or whatever. The other thing is right as well. So reaching sustainability coming from an ESA project, let's say, is the difficult part, because I know that, and we know quite well, that ESA does not have the mandate to have operational services. That's still just not there. So that's why I put in the third column, in 5 years, have a Copernicus Health Service, because I know how that works. in the end, if you want this operationally monitoring, it has to go, at least in this environment, into Copernicus. Otherwise, there's, for an SME, and we are one, there's no way to sustainably run any kind of service coming from a project. It still doesn't work. Of course, you can sustain it with a network of resources for yet another year or whatever, but this will never develop into a global, reliable service where you can go out to stakeholders and say, please rely on this service, because we cannot say for sure as a small company, it will be there in 2 years. The only entity, at least in this environment, is Copernicus or the other institutions. So thanks, Mr. B.
Thank you very much. I hate to close the discussions, but some people have trains and flights to catch. So we will just say a few words of thanks to all the participants, to our speakers, the panelists, and of course our co-organizers and the teams behind the scenes from ESA and WUHA. Thank you so much for everything. So everybody brought his expertise or her expertise, the passion, the commitment. It was really wonderful to see the exchanges and truly inspiring. So looking forward, I hope this discussion that we had here throughout the conference will not only drive future research or innovations and applications, but also foster new partnerships among the different organizations here and to have solutions that we can provide to our member countries. So I hope you felt at home in WUHA and you enjoyed our premises, and we can have more interactions like this and host more conferences for Earth observations. But also to have partnerships with you and to have more projects working on animal health and welfare and on One Health in general. So thank you so much, and we look forward to see you again very soon. Thank you.
There is a USB stick here that someone left. So maybe I'll